the House of Commons this week declaring that China is committing genocide against the Uyghur Muslims and other Turkic Muslims. Why don't we start with you, Jason? Why did the Conservatives do this, and why do you think the Liberals voted the way they did?
Well, and the first thing I want to say on this, Rob, is I don't want to pretend this is an easy issue, and there's some trite, simple answer to this one because I think there's too much, sort of reductive analysis on this. So first of all, why did the Conservatives do it? Because I think it's the right thing to do, and they wanted to put a little pressure on the Liberals. Sort of pull back the curtain. The Liberals. One of the things that Mr. O'Toole thinks really strongly about, feels really strongly about. One of the things that we really know about him, and I know having spoken with him, is he really feels strongly personally about this issue, and thinks that Canada has to stand up and be counted. So that's number one. Number two, why did the Liberals vote for it? Because it's the right thing to do, and they knew they had no other choice. I think, if they voted against this motion, they would have shown that they would have looked like spineless cowards, and they would have also looked as though they were it's so true that it's just there's no other way to vote on this. It's plain as the nose on
But
your
what
face.
about the cabinet abstaining and the prime minister?
Well, I mean, a bit of an embarrassing position to be in, and again, I don't want to sort of be as reductive as to say, boy, they should be ashamed of themselves. Like, I get that there's some strategy here. Like, I'm not dense enough to know too dense to know that there's not a strategy here, which is let the Liberal MPs, let the Liberal cabinet be the good cop. But man, what a terrible look! Like, when you think about the great moments in Canadian history, the Marathon of Hope, Vimy Ridge, inventing insulin, the famous five fighting for suffrage rights, like abstaining from a vote on on a genocide in China is not one of those times. And poor Mr. Garneau had to go stand in the House or stand in from a Zoom screen and say he was abstaining. What an embarrassment.
Yeah. On behalf of the government of Canada, I abstain. Okay. Susan, what do you think?
So, first of all, the situation with the Uyghurs is awful. It's terrible. And something does need to be done, but it needs to be done in a way that's effective. And I think when dealing with China, the size and scope of China and the Chinese government, one country alone is not going to have an effect. I was pleased to see that the vote passed, that motion passed 266-0. So there was no opposition to it. And Jason is right, there is a strategy. And dealing with China is not, like, soapbox politics doesn't work for dealing with China. In terms of trying to deal with the issue with the Uyghurs, the government also has to look at the bigger situation, which is the two Michaels, which, Joe Biden talked about. There are other issues at play, and it definitely is complicated. I think, sure, there's maybe a bit of short-term red-facedness around the parsing of this vote, but on the whole, Parliament made a declaration, while at the same time the government of Canada can continue to work with its colleagues and its allies, which is what you need to do with China. Last week, there was the declaration, 56 or 57 countries signed and led by Canada in terms of pulling it together, this declaration against detention of people.
Hostage diplomacy, basically.
Thank you. Hostage diplomacy. Yeah. Thank you, Rob. That's why you're the host. Hostage diplomacy, right? It didn't name China, but it was directed at China. But that was a big group of countries with an obvious target. And that's the way to deal with, that's the most effective way to deal with China. And I think Canada is deploying and employing that strategy. And I think hopefully in the shorter to medium term and not the long term, because it's a terrible situation, that it has some effect, but it's very, very difficult to move the Chinese dragon.
I don't think there's a lot of daylight between you and Jason on this one. So, well, look, we'll stop right here. We'll come back, talk about a few more political figures. Erin O'Toole trying to portray the Conservatives as a more moderate, more centrist party. Get your assessment of that. And Annamie Paul was just on my show a few minutes ago. The Green Party leader confirmed, right, running in Toronto Centre. But can she really defeat someone like Marcy Ian? We'll talk about that if we have time. Gotta rush. We gotta go. Be right back. Political Fix on City News.
The Snowsuit Fund is in almost its 40th year. We've been helping low-income families keep children warm during our cold winters in Ottawa. Last season we distributed over 16,000 snowsuits to families in our Ottawa area. Well, it originally started with just a handful of snowsuits being handed out, and it has now grown to 16,000 each year. All families must qualify for a snowsuit. We have a eligibility criteria that we follow, and it's based on low income. We follow the Stats Canada guidelines. If families are receiving assistance, they receive a snowsuit from us if they need one. We are no government funding. We are supported by the community. All our donations come from generous supporters in the community. People can donate directly to the Snowsuit Fund. $50 buys a brand new snowsuit for a child in need. Online you can do through Canada Helps or directly through the Snowsuit Fund. Well, the Snowsuit Fund has really had to change its operation this season with the physical distancing. Normally we have many families coming in at the same time. We are now by appointment only. We don't know if our numbers will increase, but we expect that they will go up this season. Unfortunately, this season we are not able to have the volunteers due to the spacing. Last season we had over 700 volunteers, but this year we have only allowing 8 volunteers, and they have to be continual volunteers on a regular basis. So we're not changing and introducing new people in the depot.
It's just a great charity to get involved in, and it's really when you come here and see what happens at the depot that it really starts to hook you when you see people walk in. I mean, it's changed a lot this year in terms of how the depot is working, but I was here in the days when families would show up and there could be anywhere from a mother and a single child to 12 family members, getting snowsuits and running back to the warehouse and getting different colors and different sizes. And the one constant that has always stuck with me is when you take a snowsuit out and you see a child's face. I mean, if you want to see some bright eyes and some wide grins, it's amazing. When they leave here, they're just incredibly happy.
Well, I think this year with COVID, I think it's very important that children have the opportunity to play outside and have a warm snowsuit. And thanks to the generous community, we are fortunate to provide these snowsuits to them. And I hope that once again we can count on their support.
A pillar of community opinion.
The Rob Snow Show returns
On Rogers TV and City News.
101.1 FM
And 1310 AM.
Okay, we don't have a lot of time. David says we only have 5 minutes to go here. Political Fix, Susan Smith from Blue Sky, Jason Leader from Enterprise. I do want to talk about Annamie Paul because she was just on our show, and I asked her about running in Toronto Centre. They just had a by-election there because Bill Morneau left, and then the Liberals, their candidate was Marcy Ian, who used to be on, what's that called? CTV Morning Live or Canada AM or whatever it's called, the CTV morning show. And she won. It's a very safe Liberal seat. And I asked her, Annamie Paul, why are you going to run there again?
And so for me, I chose a community that I know very well, that I'm very committed to, and goodness knows could really use the help. With the greatest of respect to its current MP, you have to have the freedom to say what needs to be said and do the things that need to be done without worrying about how it's going to impact your relationship with the leader of your party. I'm in the position to do that. And so I think that's what people in Toronto
I don't know. I question the wisdom of it. What do you think, Jason?
Question the wisdom, Rob. You're being diplomatic. I mean, come on, right? So she's a terrific young leader of a movement, of a party. She is, good. She should be in Parliament, right? I think we can all agree probably on
absolutely,
that. Absolutely, yeah. And she's not going to be in Parliament because she chose the wrong seat. And the truth is, leadership means making tough decisions. And one of the tough decisions is, I know she thinks she's being brave. I know she thinks she's sort of, betting on herself, a la Fred VanVleet or whatever. The truth is she's going to lose this seat. and she's not going to be in Parliament because of it. And she should have taken a look at what Elizabeth May learned over the years, which was go west, find a place on Salt Spring Island or, wherever the heck we're talking about.
Go to Guelph. Go to Guelph.
Or Guelph, right. Exactly. Or Guelph. And get yourself in Parliament. That's your first job as the leader of the party, is to get yourself in Parliament. Now, her running there is like her running in Crowfoot. It's not going to happen.
Yeah.
And so, and Justin Trudeau.
Well, it's like her running in Vanier. It's like
exactly.
you just
Justin Trudeau is very, very, very popular. I can think of another riding in Canada that he is more popular in than that riding, and that's gonna be the thing that stinks her. And it's too bad because she's terrific.
Yeah. Okay, Susan, what do you think, Susan?
I agree. It'll be her third time running in that riding. I did my homework. She ran in 2019 and got 7% of the vote. She ran in the by-election when we had half the voter turnout. She got 32% of the vote. She grew her vote, but Marcy Ian is well known. She's a well-known person in a Liberal riding, and people usually like to have a voice in government, but that's been a Liberal riding even when it hasn't been government. So I think Jason's right. From a leadership perspective, she's actually doing her party disservice, because in theory, too, don't forget, in a campaign, she should be fighting hard to win more seats across the country, and she's going to have to be fighting hard just to win her own seat. So her own election energies will be not divided the right way. Either she's going to let the party down because she's not channeling where she needs to be to help grow the seats overall, and she's also not going to be able, or she's not going to be able to put the time and energy she needs in to try and grow her own vote in the riding.
Yeah. Okay. Aaron O'Toole, let's say 90 seconds here. Aaron O'Toole has been trying his best to portray the Conservative Party of Canada as a more moderate, more centrist. Is he making any progress there, do you think, Jason? Is he doing okay?
I think very little, and I don't think it has anything to do with Mr. O'Toole. Governments defeat themselves, or they don't, especially in this kind of a scenario. The good news for Mr. O'Toole is that Mr. Trudeau's negatives are up a little bit. The vaccine schmozzle has hurt him a bit. But, nobody, and I mean nobody, outside Aaron O'Toole's sort of immediate family is going to bed thinking about what Aaron O'Toole thinks about anything. Just like they don't think about, Stephen Del Duca or Enemy Paul or whoever. It's government time. It's government all the time until Mr. Trudeau, right. Rising or falling on the vaccine.
What have you done for me lately, Mr. Trudeau? And, I guess the fortunes of the election will turn on that. Do you agree there, Susan?
Yeah, I think so.
Everybody's agreeable this week.
Well, I could say, Jason and I, we're reasonable people.
Yeah.
Like Biden and Trudeau this week.
Yes.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Call the Rogers TV viewer response line. Email us or connect with us on social media.
I'm Wendell Clark with a word about winning. We all know it takes a team effort in any sport and with any challenge. You can be a part of the winning team that shuts out impaired driving. Whether you're out on the town or just hanging out with friends, drink responsibly. Always have a plan for a safe ride home for yourself, your family, and your friends. You'll be helping to shut out impaired driving.
Visit ArriveAlive.org to find out more. Arrive Alive. Drive sober.
Each week on Grill This, Smoke That, Steph Legary showcases delicious recipes from across Canada, all done on the grill. Join Steph and his special guests on Grill This, Smoke That, Fridays on Rogers TV.
This is Rogers TV Ottawa.
can do that for you, Counselor.
Thank you. Give me a really neat title tonight, please.
What do you want, Riley? Be whatever you want.
King of Carlington.
Good luck to you guys. Boy, oh boy.
Oh, wow. That's a lot of power you're giving us, Riley.
Good morning, ladies and gentlemen. Bonjour, mesdames et messieurs, et bienvenue à la réunion du Conseil municipal pour le 24
Welcome to City Hall for the council meeting.
February 24th, 2021, by electronic participation. This meeting will be held through electronic participation in accordance with Section 238 of the Municipal Act as amended by the COVID-19 Economic Recovery Act 2020. Excuse me. A few reminders for today's meeting, which is being held using Zoom. Members of council and staff stay on mute unless called upon to speak. Phone-in participants, please use *6 to mute and unmute. And members of council who wish to speak to an item, please use the raise hand feature located at the bottom of the participants list in Zoom, *9 for members on the phone. This meeting will be broadcast on Rogers TV, Cable 22 in English, et Câble 23 en français, and the Ottawa City Council YouTube channel. And participants with their cameras on, please ensure that you're centered and as close to the top of the frame as possible. For those who are able to, please rise for a moment of personal reflection. Great, thank you. Well, I know a number of members of council are wearing pink today, and some were not able to. I think some got caught in the washing machine. I heard the discussion a little early on. I just want to show this beautiful T-shirt that the Ottawa Professional Firefighters Association sent to me and dropped by yesterday. They're running a fundraising campaign where the funds go to Proud to Be Me, an organization I know many of us know about. And I know Councillor Hubley knows the organization very, very well. And I think, Alan, you have the most shocking pink on of anyone today. You look great in it. And our thanks to the firefighters. I know that if you go to the Ottawa Professional Firefighters website, or I suppose you could even drop in a fire station, they could sell you one of these great shirts, and the money goes to a great cause of anti-bullying. So thank you all very, very much for showing your support. And as you know, and I think Councillor McKinney has pink running shoes on, I'm told. So we're going to see those. There they are. They're beautiful. Roll call, please, Madam Deputy Clerk.
Conseiller Luloff.
Présent.
Councillor Dudas.
Ici.
Councillor Harder.
Here.
Councillor Suds.
Here.
Councillor El Shantiri.
Present.
Councillor Gower.
Here.
Councillor Kavanagh.
Here.
Councillor Shirelli. Councillor Eglar.
Here.
Councillor Deans.
Here.
Councillor Tierney.
Présent.
Conseiller Fleury.
Bonjour.
Councillor King.
Present.
Councillor McKenney.
Present.
Councillor Leeper.
Here.
Councillor Brockington.
Good morning.
Councillor Menard.
Morning.
Councillor Cloutier.
Présent.
Councillor Kitts.
Here.
Councillor DeRoos.
Here.
Councillor Moffat.
Here.
Councillor Meehan.
Here.
Councillor Hubley.
Here.
Mayor Watson.
Ici.
Le quorum est atteint, Monsieur le Maire.
Merci.
You have quorum.
2021, adoption of the minutes for the council meeting of the 10th of February 2021. Carried. Declaration of interest, including those originally arising from prior meetings. Déclaration de conflit d'intérêt. Anyone have a conflict? No. Communications as presented, regrets, absence, no regrets filed to date. A motion to introduce reports. Motion portant présentation de rapport. Conseillère Meehan, s'il vous plaît.
Thank you, Chair. That the report from the Ottawa Police Services Board entitled Board Activity, Training and Performance, 2020 Annual Report, Agricultural and Rural Affairs Committee Report 19, Community and Protective Services Committee Report 16, Standing Committee on Environmental Protection, Water and Waste Management Report 14, Planning Committee Meeting Reports 36 and 37, Transit Commission Report 9, and the report from the City Clerk entitled Summary of Oral and Written Public Submissions for Items Subject to the Planning Act Explanation Requirements at the City Council meeting of February 10th, 2021, be received and considered.
Carried? Carried. We'll go through the consent agenda first, colleagues, and then we'll go to our COVID-19 updates. So we have report from the Ottawa Police Services Board, Commission de Services de Police d'Ottawa, Board Activity, Training and Performance 2020 Annual Report. Rapport annuel pour l'année 2020. Carried?
Carried.
Next is committee reports. Rapport des comités Agriculture and Rural Affairs Committee Report. Rapport 19 du Comité de l'Agriculture et des Affaires Rurales. Zoning Bylaw Amendment 4497 O'Keefe Court. Modification au règlement de zonage 4497 Cour O'Keefe. Carried. Community and Protective Services Committee. Report number 16. Rapport number 16 du Comité des Services Communautaires et de Protection. Commemorative naming proposal, Annie Pootoogook Park, Parc Annie Pootoogook. Carried. Item number 5 is 2021 Ottawa Emergency Shelter Standards and 2021 Ottawa Transitional Housing Program Standards, Normes des réfugiés d'urgence d'Ottawa 2021.
Monsieur le maire, j'avais levé ma main pour l'autre thème. Je suis désolé.
I raised my hand, Mr. Mayor, for the other item. I'm sorry. Is it for questions or just no question for the shelters, but for the naming of the park. A few words now then? Yes, if you don't mind. I'd like to thank the city for this process that was very well received, especially by Stéphanie Plante and Action Sandy Hill, as well as the arts community, the Galerie d'Art d'Ottawa, the Saw Gallery, and the National Gallery, who are part of this initiative. I can't wait to see the programming of Inuit arts that will be coming up. So thank you very much, Mr. Mayor. Very positive initiative indeed.
Residential stormwater retrofit pilot program, Rain Ready. Carrie?
I'd like to hold for a question.
Is it a quick one, or do you want us to hold it and come back, Councillor?
Come back.
All right.
Thanks.
For item number 6, is that correct? Yeah, I think the clerk reminds us we have to adopt number 5 as well. Carried, and we'll come back to number 6 for Councillor Kavanagh. And number 7 is Lemire Island Water Purification Plant Improvement Project. Carried.
Carried.
Planning Committee Report number 36, rapport numéro 36 du Comité de l'Urbanisme. We have a motion to defer this, I believe, moved by Councillor Leeper, seconded by Councillor Harder. Councillor Leeper, do you want to introduce the motion to defer this?
Chair, I think that was 1705.
Yes.
Number 8 is application to alter the Chateau Laurier.
Yes.
I'm not suggesting moving the Chateau Laurier.
No, sorry. It's number 13. We'll come back to that. And we'll come back, I think, to the Chateau Laurier because there'll be questions on that. Item 9, zoning bylaw amendment 847 Woodruff Avenue, modification de règlement zonage 847 Avenue Woodruff. Carried?
Carried.
Item 10, zoning bylaw amendment 300 Mewati private, modification de règlement zonage 300 voies privées Mewati. Carried?
Carried.
Item 11, East Urban Community Phase 3 area, community design plan, secondary plan, collectivité urbaine de l'Est, phase 3. Carried?
Carried.
Item 12, Westboro infill study, interim control bylaw area, modification de règlement de zonage, secteur visé par l'étude de zonage sur les aménagements dans Westboro.
Mayor, may I just make a quick comment on that?
Okay, go ahead.
Just to say thank you very much to Council who originally agreed to the triplex ban that led to this study. There's been a lot of discussion of the new rules that are being proposed, and it's going to be a matter of some further conversation for some time with residents in order that everyone understands exactly what these new rules allow and what they don't. I'm going to suggest that other councillors who have R3 zones should take a look at these rules in depth and come to grips with those, because I think it is an indication of where the new official plan is going to go. But today I did want to make sure that I thanked Eric Milligan, Karen Johnson, Gary Ludington, who are community members who have been part of the consultation and leading it for the last 2 years with other residents. Robert Sandercott at the city and the planning department has put in amazing work to get us to this point. And thank you very much to Murray Chown and Rosalind Hill, who were industry representatives to contribute to what turned out to be a very long study of the new rules that are going to guide infill development in Westboro. Thank you, Mayor.
Great, thank you, Councillor. On the motion, adopté, carried. This is now the item for deferral. Councillor Leeper, back to you on 1705 Carling And it says motion requiring suspension of the rules. Suspension is not required. This is just a deferral motion. So Councillor Leeper, would you like to introduce the deferral, seconded by Councillor Harder?
Thanks, Chair. And I've only just received notice of this. Apparently, there are some errors in the zoning schedule that the developer would like to address. So I certainly have no objection to moving a deferral on this so that everyone has a common understanding of what it is that we're passing.
Okay, and it's up on the screen now. Any questions on deferral? On deferral by Councillor Leeper, seconded by Councillor Harder. Carried. Adopté. Merci. Item 14, numéro 14, demande de modification visant le 593 Avenue Laurier West, a property designated under Part 4 of the Ontario Heritage Act. Carried. Item 15, zoning bylaw amendment 593 Laurier Avenue West, modification de règlement de zonage 593 Avenue Laurier West. Carried. Transit Commission report number 9, rapport numéro 9 de la Commission de transport en commune. Item 16, amendments to the transit bylaw, modification au règlement municipal sur le transport en commune. Councillor Hubley has a motion of clarification, seconded by Councillor Cloutier. So Councillor Hubley, if you'd like to introduce this regarding scooters on sidewalks being not allowed.
Yeah, I'm sorry, Mr. Mayor. Could I ask the Vice Chair to read it? I don't have, oh, there it is up on the screen. Okay. Whereas the Transit Commission's meeting of February 17, 2021 directed Transportation Services Department to ensure the proposed amendments to the transit bylaw respecting electric kick scooters are consistent with the electric kick scooter strategy and pilot project and the electric kick scooter bylaws. Whereas the electric kick scooter bylaw prohibits the use of electric kick scooters on city sidewalks, therefore be it resolved the word sidewalks in quote marks be deleted from the report entitled Amendments to the Transit Bylaw. Thank you, Mr. Mayor.
Okay, so this is just a clarification to ensure that scooters are not going to be permitted on sidewalks. Anyone have any comments or questions on the motion by Councillors Hubley and Cloutier? So on the motion, carried. And on the main report as amended, carried. Does anyone wish to remove anything from the bulk consent agenda?
Mr. Mayor, sorry, I'm slow on my mute button. Can I thank Councillor McKenney for her work on the scooter strategy, please? It was her suggestion to do this amendment.
No, you're not allowed to thank her. No, I'm sorry, that's a rule. Absolutely, yes. Thank you for doing that. Does anyone wish to remove anything from the bulk consent agenda? So on the bulk consent agenda as presented?
Carried.
Well, good morning, everyone. Bonjour tout le monde, and thank you very much for joining us at today's City Council meeting. As many of you know, Ottawa has recently returned to the orange restrict status in the provincial COVID-19 response framework. This is great news for residents and our economy, but we cannot throw caution to the wind and let our guard down. We've seen cases steadily rise over the last week, and we have seen in the past what happens when we do let our guard down. You'll hear from Dr. Etches, we need to ensure that we are sticking to the basic public health guidelines. Nous devons nous assurer de suivre les lignes directrices.
We must apply all the public health guidelines.
Limiting your close contacts to those in your household, especially when you're taking part in activities when you can't physically distance or wear a mask. The work residents have done to quickly get our high numbers over the holidays down was incredible, and we must continue those efforts going forward. We've been dealing with COVID-19 now for nearly a year. When you think about that, it was the first case in Ottawa was sometime in March, and we're almost in the month of March. And the roller coasters of lockdowns and reopenings have had a tremendous negative impact on our collective mental health. Yesterday, I had a chance to speak with local small business owners on this very subject as part of a forum on small business owners and mental health. Some of the conversations we had were difficult ones. The level of anxiety and worry these small business owners are feeling is real. I want to thank Mark Kaluski and Michelle Grew of the Ottawa Council of Business Improvement Areas as well as Michael Wood, himself a business owner, for organizing the event. I also want to thank Ben Lakin at Ottawa Public Health and Dr. Raj Batla, who's Chief Psychiatrist at the Royal Ottawa, for their support in this important forum, as well as 2 provincial cabinet ministers, and I know a number of colleagues from council were also on that Zoom meeting. I would urge anyone who is seeking support to please visit ottawapublichealth.ca/COVID mental health or contact the Ottawa Distress Centre at 613-238-3311. That's 613-238-3311. I want to commend our small businesses for the work that they have done in keeping their staff and their customers safe. Je tiens à féliciter nos petites entreprises pour le travail qu'elles ont accompli pour assurer la sécurité de leur personnel et de leurs clients. Many of our city's business improvement areas maintain directories of businesses that offer both in-person and online shopping experiences. Later this week, the City of Ottawa's Instagram page will be highlighting many of the city's great BIAs and how residents can safely shop in their areas. If you're not comfortable visiting businesses in person, there are other ways you can support local. You can order takeout or delivery from your favorite local restaurants. You can purchase gift cards from local shops to use at a later date. You can choose small local businesses when shopping online and encourage your family and friends to do the same. You can also promote local businesses on your social media channels or leave them a good review or share positive posts. I want to thank everyone who's been supporting our great local businesses throughout the pandemic, and I encourage residents to keep this support going. J'encourage les résidents à maintenir ce soutien. I recognize that residents are eager to know more information regarding the COVID-19 vaccine and vaccine processes and timelines. Yesterday, we hit another important milestone with all eligible and willing residents of the 82 retirement homes in Ottawa having received their first dose of COVID-19 vaccine. We could not have reached this milestone without the efforts of mobile vaccination teams comprised of staff from the Ottawa Paramedic Service, Ottawa Public Health, the Ottawa Hospital, the Queensway Carleton Hospital, Ottawa City Inner City Health, community physicians, community health centers, and the retirement facilities themselves. Our staff and community partners have been leaders in controlling this virus. I know they will be leaders in delivering the vaccine. With every milestone hit, it gives me even more confidence that when the vaccine is available broadly to the general public, we will be ready to serve our residents. Anthony DeMonte, our General Manager of Emergency and Protective Services, will provide a detailed update regarding the vaccine rollout today at Council, including how we will be reaching our 80+ residents outside of care homes. We are once again leading the province in providing the vaccine to our residents. La campagne de vaccination à Ottawa continue à connaître de succès grâce au bon travail des gens.
Our campaign is still successful thanks to the good work of healthcare workers.
With their Ontario big city mayors and General Rick Hillier and on several occasions brought up Ottawa as an example of how to deliver the vaccine to the public. It's a testament to the hard work of our staff, and I want to thank them for being leaders across not just Ontario, but Canada. I know with each milestone hit, we all get more anxious to get the vaccine for ourselves, but we do still need to be patient. It will be several months until the vaccine is widely available to the public. When that time comes, I want to assure everyone that the city, Ottawa Public Health, and our partners are ready to go when more vaccines arrive and in larger quantities. Our vaccination teams are doing tremendous work and are becoming more efficient with experience. I want to thank them for their exceptional efforts to protect the health and safety of our community, starting with our most vulnerable residents in long-term care homes, retirement homes, and first responders. As I mentioned before, this is a team effort, and I stress that point today. All of us, residents, businesses, governments, need to continue to work collaboratively so we can limit the spread of COVID-19 in our community. Last Saturday, it was a beautiful day in the nation's capital, and it was the first weekend since the lockdown was lifted. When I was out grocery shopping at Carlingwood, The mall was open for the first time in a long while, with most stores open, and you could literally see in people's faces a sense of relief and a lot more smiles. People were relieved. There was a bit of normalcy that was brought back to our daily lives. But I have to continue to warn the residents of Ottawa to let's not blow this. Let's not go back to our old habits, and let's not give the province a reason to put us back in lockdown. Wear a mask, be socially distant, wash your hands, and be kind. We're going to ask Mr. Damonte to speak first, then I'll ask Councillor Eglai, Chair of OPH, who continues to do great work on our behalf and the people's behalf, and then Dr. Vera Etches, and we'll save the questions until the presentations are all over. Mr. Damonte, please.
Thank you, Mayor. Good morning, everyone. I'll let the clerk get the first slide deck up. First slide, please. Thank you. Bonjour tout le monde. Today, I'm pleased to provide members of council with an update on Ottawa's COVID-19 vaccination rollout on behalf of the city's Emergency Operations Centre, which includes every city department and our colleagues at Ottawa Public Health. Next slide, please. As I've shared before, the goal of the EOC and our partners is to provide a COVID-19 vaccine to all eligible Ottawa residents who want one. Le but est de vacciner contre la COVID-19 tous les résidents.
We want to offer a vaccine against COVID-19 to all residents.
To vaccinate Ottawa, the city continues to collaborate with several partners who are working together in service to our community. La Ville continue de collaborer avec plusieurs partenaires qui travaillent ensemble au service de notre collectivité. We truly are one city and one team. It is expected that additional partners will be engaged as the vaccine rollout expands in the coming months. Next slide, please. As you may recall, the vaccine rollout began in Ottawa on December 15th, when the first vaccine was administered at the Ottawa Hospital Clinic. Since then, we have hit several important milestones. Depuis, nous avons franchi plusieurs étapes importantes. The province announced last week that residents of all long-term care homes across the province of Ontario have been given an opportunity for their first dose of COVID-19. Here in Ottawa, residents of all 28 long-term care homes have received their second doses of vaccine by February 5th. On February 17th, the Wabano Centre for Aboriginal Health and the Akusavik Inuit Family Healthcare Team, in participation with Ottawa Public Health, began administering first doses of vaccine to Indigenous elders and older adults. And just yesterday, all 82 designated retirement homes have received their first offer of vaccines. These achievements speak to both the enhanced efficiency through experience and, importantly, increased collaboration as part of our plan with additional local health partners. And in total, over 47,000 doses have been administered locally. Next slide, please. We continue to administer vaccines in accordance with the province's three-phase vaccine distribution plan. Nous poursuivons l'administration de vaccins conformément au plan de distribution des vaccins de la province. On February 14th, the province issued a memo directing the sequencing of Phase 1 priority groups for vaccination. As advised in a memo to members of council dated February 16th by myself and Dr. Etches, the updated Phase 1 sequencing now includes adults aged 80 years old and over, whereas this group was previously only part of Phase 2. Le séquençage mis à jour de la phase 1 comprend maintenant les adultes âgés de plus de 80 ans qui faisaient partie auparavant de la phase 2. The province also provided additional direction on the prioritization of healthcare workers identified in the Ministry of Health guidance on healthcare worker prioritization. This additional guidance includes a broader definition of healthcare workers based on the risk of exposure, patient population served, and the incidence of COVID-19 outbreaks. Next slide, please. Excuse me. The EOC and external partners have been adjusting existing plans in response to the updated direction from the province and are continuing to prioritize the most at-risk residents. Le Centre d'opération d'urgence et ses partenaires externes ont réajusté les plans actuels pour répondre à la directive mise à jour du gouvernement provincial et continuant de prioriser la population la plus à risque. As noted previously, Ottawa has completed second offers of vaccine to all 28 long-term care homes and first dose offers to all 82 designated retirement homes, including our 37 high-risk retirement homes. At present, immediate priority groups for vaccination include staff and essential caregivers that have not yet received the first dose in long-term care homes and high-risk retirement homes, the highest priority healthcare workers defined by the province to include hospitals, acute care staff and frontline roles, as well as medical first responders, and community healthcare providers serving specialized populations. Alternative level of care patients in hospitals who now have a confirmed admission to congregate care setting are also included, and Indigenous adults and higher risk communities. Vaccination groups, efforts for these groups are occurring simultaneously through multiple delivery agents, including our mobile vaccination teams that include teams from the Ottawa Paramedic Services, Queensway Carleton Hospital, community physicians and nurses within the homes, as well as the ongoing operation of the Ottawa Hospital Clinic, and as I mentioned earlier, the Wabano Centre for Aboriginal Health and the Akosavik Inuit Family Health Team. As always, the timeline for completing these immediate priority groups is dependent on the supply of vaccine from senior levels of government. Comme toujours, le calendrier de vaccination pour ces groupes.
The vaccination for these priority group depends on the supply of vaccination and the orders from the provincial governments and federal.
Subject to the incremental increase in vaccine availability, we anticipate that we will reach the next priority groups sometime in March. The next priority groups to be vaccinated will include staff, residents, and caregivers in retirement homes and other congregate care settings for seniors, priority healthcare workers, all Indigenous adults, adult recipients of chronic home care, and adults 80 years of age and over. It is anticipated that the demand for vaccine will initially exceed available supply, impacting the number and types of clinics that will be able to open. Nous prévoyons qu'au départ, la demande des vaccins dépassera.
We do believe that the demand will be much more higher than the supply of vaccine.
As well as the existing hospital clinic will be used to reach these groups initially, with the launch of 4 community clinics planned for later in March once the provincial booking system is operational and there is greater supply of vaccine. Next slide, please. As previously advised, adults 80 years of age and older are now included as part of Phase 1. However, given the limited supply, immediate access to all this population group will not be possible. The City and Ottawa Public Health will undertake a phased approach, beginning with pop-up clinics in communities that are experiencing higher rates of COVID-19 transmission. The first of these pop-up clinic locations will open up on March 5th to adults 80 years of age and older, as well as adult recipients of chronic home care that are living in specific high-risk communities. The first of these communities will include Ledbury, Herongate, Ridgemont, Emerald Woods, Sawmill Creek, and Riverview. Additional information on pop-up clinic locations and how to book an appointment will be available on Monday, March 1st. It is important to note that vaccinations for the broader 80 and over community will begin later in March, pending vaccine supply. Slide 9, please. Thank you. Adults 80 years of age and older who do not live in high-risk area will be notified when and where they can receive their vaccine via several communications channels. The City and Ottawa Public Health are developing a robust communication strategy for reaching this population. La Ville d'Ottawa et Santé publique Ottawa élaborent une stratégie de communication robuste pour atteindre ce groupe. A range of tactics will be used for communication to this priority group, including public service announcements and earned media interviews, print advertising in daily and local community newspapers, radio advertising, targeted social media advertising, targeted outreach to appropriate stakeholders, including primary care settings, community groups, apartment buildings, etc., diverse media outlets, the city's e-newsletters, and providing communication through members of council and their contact lists. Next slide, please, 10. It is important for our vaccine forecasting and clinical preparations that we have an accurate number of doses required for each priority group. Based on the new provincial direction, each outreach to community partners is underway to enumerate various priority 1 groups. It is estimated that approximately 6,000 doses will be required for hospital and acute care staff in frontline roles, some 3,100 doses for medical first responders, and 88,000 doses for 80 years of age and older. Enumeration of the number of healthcare workers serving specialized population, as well as the number of residents in congregate care settings for seniors, is currently ongoing. Slide 11, please. Up to 7 community clinics built on Ottawa Public Health's tried and tested vaccine clinic model are being readied and when vaccine supplies increase. La préparation jusqu'à 7 cliniques communautaires est en...
We have up to 7 community clinics being readied for when vaccine supply is increased.
These clinics will operate from 8 a.m. to 10 p.m. 7 days a week and have the capacity to administer nearly 11,000 immunizations a day. The 7 clinics and the existing hospital clinic at the Ottawa Hospital, with a possible second clinic opening up at Queensway Carleton Hospital, will have the capacity to provide some 3,800 immunizations per month. This is not including what also will be administered within the mobile vaccination teams and pop-up clinics that I've just mentioned, as well as primary care providers and the pharmacies. In the event of large amounts of vaccine suddenly becoming available, all these city clinics can be stood up within 72 hours notice. Si une grande quantité de vaccins devient disponible, les cliniques...
If we have a high numbers of vaccine doses available, we can actually open pop-up clinic in 72 hours.
On a 24/7 basis also continues to be explored with consideration for anticipated vaccine supply, staffing, and cleaning requirements. Slide 12, please. The 7 community clinic locations include the Ruddy Family YMYWCA in Orleans, the Saint Laurent Complex, Ottawa City Hall, the Horticulture Building at Lansdowne Park, the Canterbury Recreation Complex in Alta Vista, the Nepean Sportsplex in the South End, and the Eva James Memorial Centre in Canada. Also shown on the map is the clinic at the Ottawa Hospital Civic Campus, and as well the clinic anticipated to be open soon at the Queensway Carleton Hospital. When selecting these sites, the EOC considered locations that complied with provincial requirements that are very strict, met the needs of the community, and supported clinical objectives and activities of safety and security. It is important to note that clinic locations are not yet open. Timelines for opening these clinics are dependent on vaccine supply. Clinics will be open incrementally as supplies increase. Veuillez noter que les cliniques ne sont pas ouvertes.
Please note that some of these clinics are not yet open. It will depend on the supply of vaccines. They will be open progressively, depending on the vaccine supply.
In addition to community clinics, mobile vaccination teams have the flexibility to deliver immunization at various sites and will continue to be deployed on an as-need basis throughout the remainder of Phase 1 and into Phase 2. Teams will deploy to reach targeted populations, including the homeless and rural residents. Des équipes seront déployées pour atteindre les groupes cibles, y compris...
We will deploy some groups as needed to reach target population, namely homeless and rural residents.
The settings identified and required, this immunization model, and the anticipated number of clients. As I previously noted, pop-up clinics, which are set up for multiple days but are not permanent fixed sites, are another immunization model that will be used to vaccinate hard-to-reach populations, including adults aged 80 and over that live in these neighborhoods at higher risk of COVID-19 infection. The EOC continues to assess the optimal clinic location for this type to offer each priority group based on the population's health status, geography, accessibility, and resources. Both the mobile vaccination teams as well as the pop-up clinics will be implemented as demand and vaccine supply allows and will involve paramedics, public health staff, community physicians, pharmacists, and hospital staff. Slide 14, please. The EOC's Phase 1 plans remains dependent on vaccine supply and the implementation of a provincial booking system. Les plans de la phase 1 du centre d'opération d'urgence dépendent
So the vaccination will always depend on the vaccine supply and on the implementation of a provincial booking system.
The number and types of clinics that we can open, as well as how quickly specific priority groups will have access to book on for appointments. The systems and processes for booking appointments are being set up by the province for uses across Ontario, and the booking system will be critical to operating the community clinics. We continue to work with the provincial government on what system is going to look like for Ottawa. Slide 15, please. Ottawa vaccine distribution will continue to be informed by the provincial rollout plan, which is expected to continue to include alternative delivery agents, such as the use of pharmacies and primary care settings, amongst other strategies. Phase 1 progresses, the EOC will continue to monitor provincial direction related to sequencing and vaccine delivery to help inform our preparedness plan to receive larger quantities. We continue to build a flexible and adaptability into our planning in order to allow for delivery to be scaled up or down as required, subject to vaccine availability. The province estimates that Phase 2 could start in early April and will go until July, depending on vaccine supply. In the second phase, an increased stock of vaccine will be available to older adults, starting those who are 79 years of age and decreasing by 5-year increments, residents and staff in high-risk congregate settings such as shelters and community living, frontline essential workers such as educational workers and the food processing industry, individuals with high-risk health conditions, as well as their caregivers, and other high-risk populations. The province anticipates that the third phase of vaccine distribution could begin again in August, again depending on the availability of vaccines. Phase 3 is when the vaccines will be widely available across Ontario for anyone wishing to be immunized. Lorsque nous aurons atteint la phase 3, les vaccins seront largement disponibles partout en Ontario.
When we'll reach Phase 3, when it will be available in Ontario for anyone wishing and eligible for immunization.
In the meantime, it is important that we continue to practice good public health measures to limit the spread of COVID-19 in our community. Merci beaucoup. Thank you. Now I return it to you, Mayor.
Thank you very much. It's a very thorough presentation. If we can make sure members of council receive those slide decks, if they don't have them, I think they'd find that very helpful. Alors, merci beaucoup, Monsieur Demonte et votre équipe pour du bon travail.
Thank you very much, Mr. Demonte and your team.
And Dr. Etches speak, and we ask Councillor Eglai to offer comments in his capacity as chair of the Board of Directors of Ottawa Public Health. Councillor.
Thank you very much, Mr. Mayor. Good morning, everyone. The arrival of COVID-19 vaccines has brought hope to our community, as was evidenced earlier this week by the solid work of our vaccination teams in long-term care homes and in retirement homes. It is even more amazing to consider that less than a year ago, the COVID-19 vaccines did not exist. In fact, COVID-19 had not even yet been declared a pandemic. We were still monitoring the spread of infection in other jurisdictions and learning about the virus itself, let alone looking at vaccines. We have come a long way since then, and we know there are lots of questions. For now, we must focus on what is within our control, keeping COVID-19 levels manageable until there's enough vaccine available to all eligible residents of Ottawa who wish to receive one. There will be several months, as we've learned, until vaccines are available to the general population, and more vigorous public health measures may be required if more transmissible variants of concern take root. We must continue with our routine behaviors that we know keep COVID-19 transmission low. Wear a mask, limit close contact to people you live with, stay 2 meters apart from others, stay home when you're sick, except to get tested, and practice proper hand hygiene. We should not be taking unnecessary risks, such as getting into a ride share with 6 other people. We should be acting reasonably in light of our circumstances, which means cautiously in light of COVID. Thanks to the people of Ottawa for once again getting us to a place where we have been able to cautiously reopen schools and businesses. We know this hasn't been easy, but the fact that we've been able to slowly reopen is direct proof that our actions do matter. OPH continues to work closely with local businesses and employers to ensure proper measures are in place to reduce COVID-19 transmission. Ottawa businesses have been working hard and doing an incredible job at keeping employees and members of the community as safe as possible. We would also like to thank our partners at the National Capital Commission, who work closely with OPH to communicate with residents on how to best enjoy skating on the canal while remaining COVID-wise. I'd also like to thank the NCC and our community partners for taking the time and effort to maintain close to 100 kilometers of winter trails in Ottawa for skiing, snowshoeing, fat biking, and more. For so many of us, this is our escape. We are extremely lucky in Ottawa to have access to world-class winter activities. Outdoor activities are good for both physical and mental health and usually carry a lower risk of COVID transmission than indoor activities. Remember, the safest option is to choose activities that can be done with just your household contacts or with social support persons if you live alone. If you choose to get together with others, choose activities that allow for 2 meters of spacing. For many of us, this past year has been one of the most challenging times of our lives. The reopening of schools and childcare centers has been difficult for parents, guardians, children, school staff, childcare providers, and caregivers. Throughout the pandemic, children and youth have had to miss out on many normal activities that help support their mental health. By talking about mental health openly, you can help your child work through their feelings and practice resiliency. If you or someone you know is struggling with their mental health, now is the time to have that talk. Reach out, speak to someone today. Free mental health and substance abuse resources can be found on the OPH website, including new information on how to manage mental health during the winter months. Please remember, it is okay not to be okay. Even small actions, from recognizing stressors to being there for a loved one, can help support mental health and strengthen our communities. Thank you, and I'm now going to turn the presentation over to Dr. Etches.
Bonjour. You'll see, good morning. I'm going to speak through some slides as well, and I want to thank Mr. DeMonte for describing the approach to vaccination that is so important in our city, and all of the city departments that are supporting this effort. In my presentation today, I will spend a bit of time talking about the current situation of COVID in our community, what I think we need to do about it, as well as why we're proceeding the way we are with the vaccination campaign in the next number of weeks. What's the rationale for focusing on the populations that we are? So on the next slide, I think it's helpful to keep the goals in mind. Le but de la réponse de la pandémie. We are trying to minimize hospitalizations and deaths, not just from COVID, but for all health reasons. We are trying to minimize societal disruption, and that includes keeping schools open so that families can function as best as they can and people can work. Trying to keep businesses open, people employed. And practically speaking, what are we aiming for? What's a good goal that's most immediate? We're trying to move towards yellow in the provincial framework, where we have less COVID in the community and more services open, more ability to gather. And the tools that we have haven't changed a lot, but they have been strengthened in some places. I want to speak, of course, about the importance of preventing transmission of COVID. It's the foundation. It's better to not get infected in the first place than to have to go get tested and follow up with people. And it may be, whatever age you are, that you are that person who could have a serious infection. And we just want to prevent that. The preventive measures have been strengthened in terms of the risk of importing COVID with travel, with people testing before they come, when they arrive, quarantine now in hotels. And the workplace measures also have been, an ongoing point of importance, protecting workers with the right masks and eye shields and ability to distance in the workplace. And a lot does come down to our individual behaviors. You've heard the mayor and the chair and Mr. DeMonte mention our individual behaviors. It seems hard after a year to think that it's still sort of up to us. But what we have to achieve to limit COVID transmission in Ottawa is more often than not, we need 2 meters distance between ourselves and others so COVID can't be transmitted. And that is hard to regulate, right? The provincial framework says right now, it's legal. You could have 10 people in your house indoors and you could gather with 25 outdoors. That's like a speed limit, but we're in the middle of a snowstorm and we shouldn't be pushing the speed limit, right? We need to be driving according to the conditions. And in this case, it means we need to be limiting our close contacts, to the members of our household. That's the same thing that kept us with lower levels in the fall. And we saw it was the social connections over the holidays that drove rates up quickly. So there is a lot that's in our control when it comes to our individual behaviors. Now, the other systems that have been strengthened, the testing and the tracing, for example, we have continued to look at where testing needs to be offered in communities. Like the model in Vanier, like opening up a community-based approach with the Asuna Muslim Association. These are community-driven, where we're looking at working with the community to decrease barriers to access for testing. And we're also looking at school communities where we see neighborhoods with higher rates or a higher number of high-risk contacts in school communities. The number of people showing up for those opportunities we offer on weekends has really grown over the last 4 weekends that we've been doing this. We're also testing asymptomatic people through that process with rapid testing. And in fact, lately, 900 people 2 weeks ago, over 700 recently, we found only one person who tested positive. So that is reassuring. But these are tools we're testing out, and we're going to continue to study and evaluate how to best use them. Rapid testing is also available for workplaces through a provincial program. So there are a number of different measures workplaces have to adhere to. The rapid testing program requires quite a bit of logistics, and Ottawa Public Health is there to respond if people do identify positives in the workplace. And anytime a rapid test is used, you have to do a confirmatory test to make sure it is indeed positive. These kinds of things are in place. Managing the outbreaks. I know people are very curious about whether we've seen less outbreaks with immunization in long-term care homes and now getting to retirement homes. We are seeing fewer residents in long-term care homes test positive. There are still outbreaks in long-term care homes. Staff are testing positive more than the residents, and it's low numbers. So there's some hopeful signs that we can't completely attribute this to vaccination yet. We need to continue to study that. But these are always things after the fact. I want to go back to the prevention. And so this is why we're so excited about the vaccination campaign. It's another tool to prevent transmission in the first place. And as others before me have just said, unfortunately, we can't rely on it to protect the whole population for a number of months. The other point that's important is that not everyone has the same ability to do the preventive measures. People are going to work in higher risk settings. People do have less ability to isolate. And so the support to populations continues to be important. That we're promoting our voluntary isolation center. It's being used. There are important services the Human Needs Task Force of the city are providing, and that needs to continue. So again, the goal, we're trying to find that balance between limiting COVID in the community and having the services and the supports open that we need. In fact, on the next slide, we are not heading towards yellow, we are heading towards red. And that's not okay because it does potentially take us into a place with, less opportunity. We could be discussing whether we need to go in red with the province next week. That is a real possibility. And so, again, we need to think about how can we be a little bit stricter with ourselves in terms of those number of close contacts. I need to share some more detail about what we're seeing when we do case and contact management. Ottawa Public Health is seeing people who test positive, who work in offices, in pharmacies, in religious communities, in coffee shops, grocery stores, warehouses, home care, security. Like, it is widespread. I just don't want people to have a sense, oh, it's under control. It's actually a constant, significant effort to try to link people and find the source, and we can't always find the source initially of people testing positive. The kinds of risks that we see that lead to transmission are fairly consistent. It still seems to be that people with mild symptoms are not always thinking this could be COVID and maybe working with mild symptoms. It also is, hard. People have been working so hard in workplaces. They're wearing masks. They're using all these new behaviors, but then during breaks, letting the guard down just a little bit. And the carpooling and the congregating in social settings, before and after work, before and after school, these are still key risk behaviors. So again, there are many indicators here that are showing us we're heading in the wrong direction. Hospitalizations are the strongest, most robust indicator of COVID in our community, but they lag by a week, and we see that is no longer declining. Our wastewater, has continued to come down. It's going more flat, more stabilizing. So I think this is telling us we're doing less well than we were, at the end of January, bringing the numbers down. And I want people not to be discouraged by this, but to realize our behavior matters. And there are these blind spots we can take a look at and tighten up. The other reason on the next slide that we need to be as robust as we can in these basic measures is that we do see variants of concern in Ottawa. And we're reporting on them publicly every day. They're on our website. There's provincial reports. We do know that it's potential that they're transmitted more easily. And so instead of thinking about just wearing a mask, and we want to be really using the best quality mask we can, right? So not a neck warmer, but a 3-layer mask if you can do that. I think just tightening up. I know there may be more questions about variants, and I'm happy to come back to that. So on the next slide, we did mention that one of the goals of the pandemic is to keep the schools open. Je voudrais souligner que c'est important pour la santé de les enfants.
This is very important for the health of our young. So we need to maintain the school opens.
Well, starting with that screening to keep people who have symptoms at home. And now it is a new provincial direction that if anyone has one symptom that could be COVID in a household, the whole household needs to stay home until that's determined that it's not COVID. That is hard. That is hard. And our school nurses see it. They see families that means somebody's out of work and they're going to have trouble buying groceries. So our school nurses are problem solving. They're working with schools to support families that are in more difficult situations. These measures are meant to further protect introduction of COVID into schools, because we do see sometimes a runny nose is the only symptom and it is COVID. So again, it's just part of this tightening up on measures. I mentioned already that we were doing some rapid testing. And the schools being open, provide really tangible supports to some, I think, where we know that even people need the access to food, and schools provide food programs or gift cards to support meals. So there's also children's safety issues that we know schools support children to stay safe. So this continues to be a goal. I'm going to move on. And in the next slide, I'm going to spend a little bit more time going through some data, which I don't always show sort of data slides in this way, but I want people to understand how we're using the vaccine to prevent the most death possible. Certainly, this is the framework of how we use the vaccine is provincially driven. On suit le cadre provincial. Et aussi, on a une groupe ici à Ottawa.
And we have proof here in Ottawa that it helps with the implementation of this provincial framework.
Task force is made up of communities that are more affected. Mr. Demonte's already spoken to the populations most at risk, so I won't read all of them to you, but this slide highlights the Indigenous population as at greater risk of COVID death from COVID mortality. We don't have that data from Canada, but we expect it would be similar to the United States, where the yellow bar is an Indigenous population mortality from COVID compared to going down the different colored bars: Asian, Black, Latino, Pacific Islander, white, and all deaths altogether. We expect this would be similar in Canada because of previous experience with infectious diseases and higher mortality, lower life expectancy, a greater burden of chronic disease. On the next slide, what is most important as a risk factor is age. So I want to walk through this. There's two columns. One is showing the risk of hospitalization going up by age if you compare it to people under 40. And so I've highlighted for people 80 to 89, there's a 40 times, just about 38 times, 40 times greater risk of hospitalization. And moving across to the column about the risk of death compared to people under 40, it's so striking. It's 2,700 times greater. And you can see this is significant. It's also significant for people in their 70s, in their 60s, and this is the overarching factor that predicts risk of death. People with chronic disease also, compared to someone without chronic disease, would have a higher risk of death or hospitalization, but it doesn't make it 40 times higher necessarily. There's been some work done that suggests if you have 3 chronic diseases at once, that may be the equivalent of moving you up like an age group in risk. So I think these are the things the province is trying to balance as we think about where to go next with the vaccination program, but we can feel very confident using age as a key driver. Next slide. In addition to age, we know that there are communities with higher rates of COVID. That has been the case throughout the pandemic. We've been working with neighborhoods where we detect geographically clusters and higher risk of COVID to address that, to make testing accessible, to look at the community supports that people need to be able to reduce transmission. What this slide is showing us, if we take a look at, there's 33 neighborhoods where we see some kind of clustering and higher rates. Most of them are lower income neighborhoods. Most of them are communities that have less advantage. And sometimes, often it overlaps with racialized communities where people have experienced discrimination and systemic barriers to health. So this graph here this is showing in the dark blue, those 33 neighborhoods. And if you look, it's not just higher rates of COVID, but then 2.6 times higher rate of hospitalization, and for death, a 3 times greater risk of death. And that's on average lumping the 33 together, but within that, we are able to separate out and find the communities and neighborhoods at highest risk. And this is what's behind the naming of some places to start, where we have limited vaccine supply. C'est pourquoi on a décidé de commencer avec les personnes.
That's why we decided to start with people who are over 80 in some neighborhoods, because the possibility of reducing hospitalization there is bigger there, and that's good for the whole population.
Hospitalization by going where we need to protect people the most and where the burden is greatest, that helps our whole healthcare system have the ability to function. So I have one last slide on this to put the two variables together. C'est un peu complexe, mais c'est de décrire la situation avec les...
It's rather complex, but we have both aspects here included, age and neighborhood.
I mentioned earlier, we want to address inequities and level the playing field for people who are facing a greater risk of COVID through vaccination. This slide actually shows you if everyone had the same risk of COVID, we would all be flat. This would not be a three-dimensional figure. And the two variables are shown. First, age is the rows across. So starting with 80-year-olds, where that yellow box is highest risk is 80-year-olds, and the other variable is neighborhoods. So they talk about postal code here, breaking it down into 10 groups from the postal codes with the highest rates of COVID down to the postal codes with the lowest rates of COVID. This data is actually for Ontario. It's calculated by the Science Advisory Table, but the picture is going to be the same for Ottawa. So starting with that yellow box, those are 80-year-olds who live in the neighborhoods, the top 10th with the highest rates of COVID. That's where we need to start. And if you can protect people there, you flatten that risk for that population. And so moving across, we would then make vaccine available to all people over 80. And then we need to move through neighborhoods at highest risk. And the only reason I'm saying we need to start like this is because we have limited supply. And in a situation of limited supply, we need to use it in the most effective way. So again, the height there, it reflects how much the mortality and the hospitalizations, that rate, grows for people in particular populations. I actually see this as a hopeful slide that we can make a difference with not as much vaccine. We don't need to get it immediately to every box on this table, although that is going to happen. So I'll move on off of some of the data again, just to say that in order to do this work, community input continues to be very important. C'est vraiment une grande collaboration de répondre.
It's a major cooperation that's needed to start the vaccination.
Exercises. We have been expanding multilingual services based on community feedback and continuing to work with so many agencies. I really want to thank everyone who's working on this. And in particular, the community health centers, the Ottawa health teams. We are working with primary care providers. Some are already immunizing with us in retirement homes. And it's the Ottawa health team, Équipe Santé Ottawa, that is really helping to organize primary care. And so on the next slide, just finish up with what we also know is important. And again, collaborative work is to address mental health in an ongoing way. C'est clair, la santé mentale continue d'être une priorité. We can all
mental health continues to be a priority.
You heard the mayor and the chair speak to it. There are supports available. I think that's the most important thing to know. And the need for culturally appropriate supports is also growing, or the need's been discussed, and the options are growing. Ottawa Public Health has been working with many different faith communities to work on suicide prevention and crisis response training and promotion of access to mental health supports. On the next slide, our website has more information about all of the things I've mentioned today. Certainly mental health resources, where you can be tested for COVID-19, and more on the vaccination campaign, logistics. This will be coming. We certainly see a need to continue to actively counter misinformation, and so really ask you to continue to point people towards our website. So in the end, le message clé sont que
the key message is that it's important to continue with actions that work and limit
steady as she
the
goes.
propagation of the virus.
Term, an old sailing term that means we might be in rough water. We need to keep it as steady as possible, as stable, the ship as stable as possible. It's not possible to keep it completely stable, but stability is important. So let's do the best we can. And we know this is the same. We need to use the behaviors that work to limit transmission, strengthen all the other supports that address COVID in our community. And I want to thank people for continuing to do this. It's hard work. It's not going to be forever. We actually will start to see an impact on less hospitalization, less death as we get to people over 80 in the community and higher priority neighborhoods. We will get through this. I want people to keep that in mind, and hopefully that end in sight gives us the strength to continue. Certainly, the most important thing being, I think, based on what we've seen, leads to resurgence, is to limit our close contacts. Alors, je voudrais merci à la ville.
So thanks again. Thank you to the city and city staff.
Dr. Thank you very much, Doctor, for that thorough report. Just a couple of quick points, and we'll ask colleagues for their questions and comments. Mr. Damonte, there's often some confusion about the difference between a retirement home and a congregate setting. We mentioned that we did very well with the retirement homes. We got everyone their first dose. And then people will contact me and say, well, my parents live in a senior's home and they have it. No one came to see them. Can you just explain to the public the difference between a retirement home and a congregate setting? I think most people understand what a long-term care home, which is the first of the priorities. I don't know if your mic's on, Mr. Damonte.
Mayor, I don't want to put my colleague, Dr. Etches, on the spot. Generally, it's public health that has those definitions, and we get them from them. So the ones that we have done that are retirement homes are defined by public health. I know there was someone tweeting to you about a site that it is not a retirement home, it is a congregate care setting. I'm sorry, I don't have that definition. We can get it for you if Dr. Etches doesn't have it offhand.
I can't read it or quote it, but I believe it's defined under regulation. So it's a provincial regulation that defines what a retirement home is. And yes, we can follow up with that specifically.
Okay. The second point is, I had raised with General Hillier on our call, and I have an in-person meeting with the General, I believe, next week, with respect to ensuring that those who are homeless and living in shelters become a higher priority, because we've seen the challenges with that vulnerable population, both in close quarters and shelters, as well as their close contact with one another. Could you just give us a sense when those people who live in shelters and are homeless can be addressed and given the vaccination as soon as possible, Dr. Etches?
Okay, Mr. Damonte, also, we talk about this together. We're a good team. I'm very thankful for Mr. Damonte. We are looking at shelters as a setting that is very similar to, analogous to a seniors congregate setting. Because there are older adults in the shelter system, And because the age and life expectancy of people who are homeless is much lower, older adults, are potentially a bit younger, but equivalent in risk. And so we do see this as part of the group of congregate care settings supporting seniors that we'll be able to get to next.
Great, thank you. The General Hillier just announced, I guess within the last hour, that the provincial registration system will be up and running by mid-March, I think March 15th. Could you just assure us, Mr. DeMonte and or Dr. Etches, that obviously we're going to continue to still put needles in arms? We're not waiting for that registration system. What will we be doing between now and then when people can register online to ensure that we don't have vials of the vaccine sitting in a freezer?
That is correct, Mayor. So the information that General Hillier just put out is March 15th. The provincial booking system will be available. And the announcement that we made today and the clear scientific evidence that Dr. Etches presented to you, the 80 plus in those vulnerable sectors, normally the rest of the province is waiting to the 15th. We are not. We're putting needles in arms of those vulnerable people earlier, and we'll continue to do that. And so, as been our practice, we're going down each of these tranches of groups based on the scientific evidence and Dr. Etch's opinion. When we have vaccine, we're putting them in arms on these groups as we go forward, the most vulnerable. So I can assure you that'll continue. And the fact that we're doing, as of March 5th, we're going to start doing 80 plus, and the rest of the province is waiting until March 15th for the provincial booking system to be available. We're putting something in place because we believe it's too urgent, and these patients are too important and too vulnerable. We must protect them as quickly as possible. So with the vaccine supply that we do have, we're starting them right away.
That's very good news to hear. My final point is, do we know the number of doses we're getting this week and next week?
Yes, Mayor. We never know, and I'm always. People have asked me until I have them in my hand and we can count and see them. But generally, we should be receiving 9,360 again this week, and the same thing for the following week. That's what we're planning for. And as I've mentioned, if ever we get an additional supply, we have our plan, and we're able to put more vaccines in more arms according to the priority that Dr. Etches and her team have identified for us. So that is what we have on the radar right now, 9,360 this week and next week.
Great. Dr. Etches, did you want to offer any other comment? No. Okay, thank you very much. Councillor Luloff, please.
Thank you very much, Mr. Mayor. I just want to take an opportunity to recognize the hard work of these teams over the course of the last year. This has been a long and protracted emergency. I understand how hard these teams are working. Teams like Dan Brisebois' team in identifying these 7 sites across the city. It makes a massive difference to the residents in all corners of this city that we have access to these public sites moving forward. And I know how hard he and his team worked before he moved on to his new role to identify these sites and to set up these partnerships. So very, very much appreciated. One thing that I see lacking, and please correct me if I'm wrong, when it comes to the communications plan for our seniors and our most vulnerable, I didn't see direct mail listed here. Social media is a great way to reach a great deal of people, as is ads in newspapers. But many seniors in my neighborhood, and I'm sure across the city, don't have access to these sorts of tools. And I'm wondering if consideration is being given to direct mail outs to our seniors to ensure that they are aware of their ability to register to get vaccinated.
Good point. I can ask Andrea, who's been working with the public health comms team. They're looking at all these strategies, and you're correct. In my speaking notes, I didn't mention that. One of the challenges we have is the short turnaround time. As you know, I think you see the common theme. We never know how much vaccine, what can go next step. So the short turnaround time is mailing in. But Andrea, I don't know if you want to add anything to that as a possible strategy as we go forward. When we have longer timelines, certainly that could be a strategy. But I'll let her and her expertise and her team speak to that.
Thank you. And yes, that is exactly correct. We are looking at mail-outs. We know that, in fact, they are the most effective in ensuring that everybody gets it at their door, particularly looking at multiple languages as well. The turnaround time is about 3 weeks, so we do have to wait until it's solidified a little bit in terms of predictability where we have the information. But yes, we are looking at that. Thank you.
Thank you very much. I really appreciate that. I know that my colleagues have quite a few questions, so I'll cede the floor to them. I can imagine that they probably have some of the same questions that I do, but I wanted to make sure that our seniors get that information as quickly as possible and in a manner that we ensure that they get it. Thank you very much.
Okay, thank you very much, Councillor. Councillor Leeper, please. I think you're muted. Councillor Leeper.
Yep. Thank you very much, Mayor. And thank you very much to Mr. Damonte. Thank you very much, Dr. Etches, for the work that you've been doing. Vaccination is obviously a huge topic of discussion in the community. I want to thank the residents of Kitchissippi who have, in general, been very patient. They understand that the supplies of vaccines are limited. They want to make sure that the folks who most need them are getting them first. You know, I'm very proud of the residents of our ward and of Ottawa for the patience that they are showing and the generosity that they're showing. I also want to thank you both very much for a note that I received this morning from Unitarian House, effusive in its praise of the vaccination effort that was undertaken there. Our retirement homes are getting the vaccine, and that's very good news. Unitarian is home to some of my favorite residents in the ward, and I'm glad that they are in good hands with the city. I do have a resident who asked me to raise a concern around definition. You know, the resident is a cancer patient with stage 4 cancer, receiving care at home. And she is wondering when she's going to be eligible for vaccination and when she is, or how she is going to find out that she is eligible. I'm looking at the presentation that Mr. Damonte put out on the provincial phases. We're wondering what the definition difference is between adult recipients of chronic home care versus individuals with high-risk chronic conditions and their caregivers. For those who have chronic conditions, who are living at home, whether it is cancer or some other underlying condition, who is making the decision about when they will receive their vaccination? When is that going to be, and how will they find out?
I'm happy to speak to. So home care recipients are the first before people with chronic disease who are not receiving home care based on the provincial definition that they are specifically in phase 1. And so we are identifying those population through home care providers. And we right now are asking that anyone who can make it out to a clinic site, which will be offering in the higher priority neighborhoods, that would be where they would access the vaccine. Unfortunately, it is a bit tricky right now with the restrictions on the transport of the vaccine to get into and take a single dose to multiple different homes. But we've been working through the transportation challenges that people may face and to look at the supports to enable people to get to one of the sites. So it's a concurrent process along with people over 80 to start to, through the home care providers, provide that access to people with home care. So again, we can't reach everyone all at once. We're going to start with the addresses in the neighborhoods where we see the highest rates.
Okay. So somebody who is, sorry, can you give me some precision around what home care means, and for the public who are watching?
I'm not sure. I mean, you are served by a home care agency. You know, whether it's nursing or personal support services, that would be counted. The Champlain Lynn, former, I think now we call it Ontario Health, you know, lead for this is Catherine Butler, and she's been helping us identify that population.
Okay, so the folks who are receiving care from organizations like, for example, Ottawa West Community Support or through the Champlain LHIN?
Yeah, the Champlain LHIN is determining the eligibility.
Okay. Like my colleague, Councillor Luloff, I'll cede because I know people have questions and I'm sure they'll answer some of the ones that I have. Thank you very much to both. I'm very heartened by what we've seen on the city side to date.
Great, thank you, Councillor, and thank you for giving up some of your time because we have a number of questions on the list here. Councillor Brockington.
Thank you, Mayor, and thank you, Mr. Damonte and Dr. Etches for your presentations. Dr. Etches, can you envision a point where even if case counts rise, we can balance public health considerations but keep schools and businesses open? How do we have that balance going forward?
Yes, eventually. And it requires community dialogue and community input. And I mean, broadly across Ontario, the public needs to inform the right balance. In the short term, I don't think with the variance as a variable that now is the time to go with more relaxation until we see what the protection is like for the most vulnerable. And we get a little bit more protection for people over 80, et cetera, because we do see as community levels rise, it reaches all age groups and it reaches more vulnerable populations. So now is not the time to go more relaxed. Now is the time of just, to reiterate one of my key messages, to be stronger as we can in limiting our contacts, wearing a quality mask, keeping the distance between each other. But the time will come. And I'm hopeful, that we will actually see more vaccine earlier than we're right now we're saying everyone who wants it will get it in September, August, September. It could be just based on the science continuing to evolve, the information about the effectiveness of the first dose. All of this will, continue to inform adjustments, but. For the short term, and by short term, I mean the next number of months, we need to be very careful.
Thank you. Yes, as our older populations are vaccinated, if the variants contribute to higher case counts for the non-vaccinated, but they're staying out of hospital, they're not dying, they're not in the ICU. My point is, I don't want schools to close or businesses close, even if our case counts go up, because there's got to be a better balance there. And I think as we're all trying to do is get our most vulnerable vaccinated as soon as possible to provide them with that added protection. Mr. Damonte, your team obviously works closely with the provincial government. You and I have had discussions about as much pressure as possible to get as much vaccine as possible. Have you ever considered buying your own vaccines?
No. For two reasons. Even provinces, and I know there's been a debate, some provinces have said that they've started negotiations with companies. It is fundamentally the responsibility of the federal government to buy vaccines for the entire country, and then the hierarchy of different levels of government. And the provinces distribute and set the priority groups, et cetera, obviously in consultation with scientific tables, et cetera. We're really the retail side of the business, and I've set up a process where which we can put needles in arms based on Dr. Etches's medical advice and scientific approach, and both of our teams work collaboratively. So our role really is we're ready, we can ramp up, we can get these 7 sites running. If I need to go 24/7, we're doing that. We're even looking, and I didn't talk in our presentation, if we had tremendous amounts, could we do a drive-through at Canadian Tire Center? Mm-hmm. Could we open up a big EY center? We're putting that in our planning process for later on. However, that said, none of what we currently know today will ever bring us as far as number of vaccine to those scenarios, because we don't perceive that right now. So the answer to your initial question is no, it's not our role.
Right now on the colored classifications, we are green, yellow, orange, red, gray. There are maximum numbers of people that can congregate at an event and in a setting. We are looking forward to summer, festival season, just events to be outside with folks. Again, those caps are set by the province. Is there any talk to give some hope to the hospitality, tourism, even families that want to travel or do things? Is there any indication whether there'll be a little bit more liberty in 2021 compared to 2020?
Again, for the next number of months, we have to be stricter rather than more relaxed. When we get to the summer, it will depend on how much vaccine has come and been delivered by that point. If we have higher levels of population protection, then it would support probably greater size of gatherings. Just as when we went into this pandemic, we stopped the biggest gatherings first, they're going to be the last to return.
Okay. My last question before I yield is just thank you. You identified the 6 at-risk communities early on in the presentation. How will additional at-risk communities other than the 6 be identified going forward? So you do your immediate visits in those 6 communities. How do you determine the next batch?
So we have the list of 33 already, where the rates of COVID are higher, the hospitalizations are higher, the deaths are higher, and so it's based on COVID rates, and we'll work through them.
Excellent. Thank you for your presentations.
Great. Thank you, Councillor Barrington. Conseiller Fleury, s'il vous plaît.
Merci, Monsieur le Maire. Merci, Tony, puis Vera.
Thank you very much, Mr. Mayor, Tony. This is a reassuring presentation. We had many presentations on a topic in the past. Question of clarification for Tony's presentation. You talked about the priority groups. At the end, you added on elders. In the provincial guidelines, they're not referring to congregated care settings and things like that. So what is written in the guidelines? Can you tell me exactly where in the presentation you saw that? It's the one listed as priority groups. You had a list. Give me a second, please. Do you have another question then? Dr. Etches, you were talking about 5 different places in the 33 priority wards, neighborhoods. Thank you very much for all of the information that you gave us about your approach. Does it mean that these 33 the first 5 ones, are you going to vaccinate people that are not yet 80 years of age? Good question. According to the provincial guidelines, we will offer the vaccine only to people aged 80 years and older, and the ones that are receiving home care in these neighborhoods. After that, I would like to be able to vaccinate people that are younger than 80 years of age in these neighborhoods. But everything will depend on what's going on at the province and when we're going to be entering phase 2. So it means that we may be going back in these neighborhoods many times, depending on your age. Exact. It will happen. I hope we're not going back 20 times, you know. We will discuss the situation with the provincial government. We want to limit the visits to maybe 1-2 times. To answer your question, Conseiller Fleury, I do not have the French translation, but I found the page. So you're talking about adults age 80 years and older, and afterwards we will decrease by groups of we will decrease by 5 years increments. Actually, I'm good with the 80 years and older. This is very clear. But how about the other age group? When you're talking about the shelters, it looks that the province is not stating an age group, but we're doing so. No, maybe this is only a misunderstanding. For these groups, such as in congregate care settings, they are in a high-risk situation setting. So when we're going there, it doesn't matter how old you are, we will vaccinate everyone in that setting. Elsewhere, it will depend on your age. So we will go down by increments of 5 years. That's the distinction. Okay, you're talking about people age 80 years and older. Some of them are independent. Sometimes, because of a language barrier or a mobility problem, what will you do? Once more, like it was mentioned earlier by Dr. Etches, we have a limited supply of vaccines. Right now, we have to do a triad, a selection. If we had a good supply, then this will not be an issue. So if we have people with mobility issue, we could focus on one area. So we will look at this into that at the time. So for the people in these age groups, we will try to provide them support. It's clear then when we're going in a very specific high-risk zones, areas, it's an environment where we will be vaccinated. It will not be within a community center. So we hope to be able, they travel, they go to the supermarket, they go to the pharmacy. For some exceptional cases, Dr. Etches and their team is trying to identify some individuals. We cannot offer the service to the whole of the population, but we understand that for some specific individual, even though they're at home, they will not be able to go to a vaccination center. I think Dr. Etches also answered another question earlier today. We cannot really displace this vaccine because of all of the criterias. It's very difficult to go door to door with the vaccine. We can't do that. It's not because we don't want to, it's just because we cannot. So we do understand your point. We're trying to see what kind of measures can be put in place to support these population. So we do want to reach them. We will try to see where are the exceptions and try to support them. Okay, you're talking about the first dose for 80 years and older. What's going to happen for the second dose of the vaccine? What's your strategy? We will be following a similar model. After we gave the first dose, we will try to schedule the date for the second dose, because we do not want to go back many, many times in the same area. So we want to go back maybe twice. So we will schedule a second dose. We will possibly receive more guidelines from the province of Ontario. Like Dr. Etches said, we have new information, there was new documentation, new research data. So we have to show flexibility. You have to understand that there's a lot of things that's happening at the provincial level that will impact the way we work at the City of Ottawa. Last questions? I have a good example to give you. So Logement Communautaire has 22 units. The residents there are all age 60 years and older. So because we're in the orange definition right now, would it be better to simply send a team over there? But because of the age group limit, right now you're not targeting them. I'll be frank with you, if Dr. Etch can complement my answer. So when we will be reaching the 60 years old age group, we might have a better supply of vaccine. I assume that the 7 centers will also be open, so we will invite them, as the rest of the general population, to go to these specific vaccination center. Even though we are working with increments of 5 years, we will invite them to present themselves at the different vaccination centers within the Ottawa.
We talked about priority groups. Glad to see the update relating to our emergency services. We've heard from the OCDSB board for teachers yesterday. Obviously, our essential workers span
1 minute.
From grocery store clerks to OCH employees to transit operators. So can you give us maybe an insight on our frontline workers that have continued to work even during the 2 lockdowns? How are we speaking for them in front of the province to get them as a priority?
The province has a specific work group for essential workers and looking at how to reach people in that category. It hasn't been communicated in the end of the final approach. What we know is that there is a strong overlap with essential workers at greatest risk with the neighborhoods that we've identified. So, for example, in long-term care homes, personal support workers have had some of the more serious infections and outcomes, and they are also, we're finding are living in these same neighborhoods that have been identified. So I think there's some overlap with the neighborhood-based approach, but really we are waiting for the final word on that from the province.
Okay, and we've communicated some of those intentions, because I'm hearing, for example, I'll give you the case for OCH. We have frontline property managers who 300 of them have had to walk into units, personal matters to repair a faucet or pest management or so on. And days later, we're found that the unit had positive cases. So, that's one example. There's, a transit operator as being another one. So how are we communicating what we're hearing on the ground to the province in that regards?
I think that we have, the opportunity to talk to the province about the vaccines, approach through teleconferences with provincial partners, and this is ongoing. This discussion. We're aware that they're working on this. They're hearing from many people about the different priorities, different types of workers. I do want to go back to age still being the most important if you're trying to prevent hospitalization and death. Okay. And then neighborhoods where the greatest burden of hospitalization and death occurs. So it like that mountain, that 3-dimensional thing, if we tackle those higher, that peak and work down, we will capture people you're describing that are at higher risk.
Anything else, Councillor?
No, merci, Monsieur Maire.
Merci. Councillor Kavanaugh, please.
Thank you very much, Mr. Mayor, and thank you, Dr. Etches and Mr. Demonte for all in a massive project of the vaccination rollout. I've been getting good feedback that people are anxious to get their vaccinations, of course, but they realize that we're ready to go, and they appreciate that. I want to thank Chair Eglai for mentioning about the winter trails. Physical activity is very important for mental health, and it's been a big boom this year. I could never have predicted this a year ago of how valuable they would be. It was meant to be helpful for mental health, but we had no idea what was ahead of us at that time. And throughout the city, it's been great. So mental health is very important. And one of the fallouts is drug addiction. And even though we're not seeing young people hit by COVID, we are seeing massive cases of drug addiction and opioid problems. Are we going to make any recommendations to the province in terms of resources towards this?
Thank you. I did have a conversation with Minister Tibollo. Now I can't remember it must have been this week, about mental health and substance use and some of the points we're seeing and areas where we could continue to work together, province and local level, to address opioid use. Certainly locally, we're working with many partners, again, the Royal and CHEO and the Canadian Center for Substance Use and Addiction and Canadian Public Health Association. We're working on addressing stigma. We're doing the training around where to access supports. And we are working to get naloxone out. That's again where we think there's some provincial barriers we could overcome with distribution of naloxone. We are working with partners, community health centers, inner city health, around safer supply, so that not for everyone, but for the particular population where that is safer than street drugs, that there's that option. But I would agree, it needs to continue to be a focus. It's something our team is working on. When we say we're working on mental health, we're working on mental health and substance use with a particular focus on opioids.
Thank you very much. I know it's an iceberg. We're only seeing the tip of it. And obviously you have to focus on the immediate with vaccinations and COVID. And but this is coming down the line, and I appreciate the work. I saw a tweet this morning from the president and CEO of CHEO, Alex Munter, about the importance of childcare workers getting vaccinated. And he included parents and caregivers of children with special needs or medical complications. Will we be advocating for this as well?
I do believe in the provincial framework for phase 2. When they talk about people with chronic conditions, they're talking also about children. But there is no vaccine for children, so they'd be looking at the caregivers or that. Yes. The caregivers for children with significant chronic diseases. Yeah.
Okay, so that will be a big part of it. I appreciate that, because that hasn't been made clear. I won't hold you up with more questions, because I know everybody else wants to ask questions. This has been very helpful. Thank you.
Great, thank you. Councillor Deans, please.
Thank you, Mayor. And I just want to start by offering my continued thanks to the entire team for your exemplary efforts and your very hard work and your longevity. I know this has gone on a long time. Mr. Damonte, I wanted to ask you more about the most impacted neighborhoods and the initial pop-ups. I just need more clarity on what that will look like, where they will be, and how people will access them. Do you have to have residency in those communities to access that site? How will that work?
Yeah, so thank you, Councillor. So the first thing, the team's currently looking at those areas, and there are provincial regulations to set up clinics, but these pop-ups are going to be more flexible. We're looking at the real estate in literally those communities, what's available, what could we set up. We're also, and Dr. Etches' team is working with some of those community groups there, and there may be natural community centers that some of these different groups go to, so we could use that as an appropriate setting to do that. And if not, we'll bring in some infrastructure. We've got buses and trailers and set it up. So that's the first part. That's what it's kind of going to look like. Something very not ad hoc, because that sounds like it's not controlled or planned, but it would be one of those, something that people would mitigate in that community naturally. That's what they do. So that's the first part of it. That communications, we're finalizing the work to do that. There's already outreach being done by public health team. So we'll be communicating with people in those communities directly. And so the multiple strategies that we have for that. So it's how could I say, it's more community based than the broad mass vaccination sites, and it's very much targeting. And what we're attempting to do, because it's for the 80 plus and those that have chronic conditions are going to be in those areas. So we're trying to make it very local, something that everybody can get to easily. And as I mentioned to another councillor's question, I think it was Councillor Fleury in French, we understand that there may be individuals that have transportation issues in that, and we're looking at those one-offs. So it's and the numbers are smaller in that. So it's very much a retail operation instead of our big mass operation that we will set up later on. We're talking in some of these communities 200 and 300 people of 80 plus and others. So we're going to be a little bit more flexible to be able to adapt. And what we want to do is put needles in their arms as quickly as possible and then move on. So I hope that gives you a bit of an idea of what we're looking at.
Just about the residency question, like if somebody is anxious to get the vaccine and doesn't live in one of those impacted areas, will they be turned away? How will that work?
Yeah, that's going to be a challenge for us, certainly. Like, I think the important thing, Dr. Etches, and when she did her presentation, we saw how disproportionately those communities are impacted. We have limited supply. If we're not getting it to those individuals, we're actually, I get it, but we're creating harm. So we will look at some model, I guess publicly, we will look at some model to control and ask people for the address of where they reside before we give them. And we'll be very clear in our communications. And when we book people into those things, we're gonna assure that they are residents of those communities because of the limited supply. What we want to say is the other communities are going to be done next, and then eventually we're going to do everybody. We're going to get to everybody as soon as we have vaccine. That's our message. But yes, Councillor Deans, we're going to ensure that the residents of those communities, because that's why we're going by those high-risk communities.
Okay, so I want to talk a bit more about those communities because you named, I think, 6.
Yeah.
And I've been looking at the neighborhood cluster report, and I'm not sure that the neighborhoods that you named are exactly what I'm reading in the neighborhood clusters reports. For example, you named Herongate and Ridgemont, but you didn't mention Hetherington, which is very high in the neighborhood cluster report. So are you what are the limits on that? When you say Herongate and Ridgemont, are you including Hetherington, or is that outside that particular cluster area?
Vera, maybe I can turn it over to you. Vera's team's been doing some very detailed work on that. Yeah.
I think probably what councillors will be interested in across the board is another layer of we use neighborhood names and they mean different things to different people. Behind it is postal code. So we have the list of the postal codes with the higher rates, and that's again what we'll be using. And I think your input, councillors, will be very important to make sure we're advertising this appropriately. So we will get you the list of the postal codes and get let's have a process for feedback on how it's communicated, so we use the right terminology.
Okay, I mean, I don't want to be too parochial because I absolutely agree that the people at highest risk need to be first at the front of the line. But I just worry about it when I look at the numbers from the cluster report, and they didn't seem to match exactly what I heard said today. So I would be very interested in seeing those postal codes to make sure that we're capturing, reflecting what we're seeing in those numbers. Also, just in looking at the diagram of the permanent centers, which I think will be more important long-term because everyone will be vaccinated at those centers. Again, at the risk of sounding a little bit too parochial, I look at the neighborhood cluster report and pretty much my entire ward is at the top of the list. Like I have Sawmill Creek, I have Emerald Woods, I have South Keys, I have Hetherington, I have Greenboro. Those are all included in the very high risk. And yet, of those 7 locations, there isn't one, like the natural place, it would seem to me, would be at the Greenboro Community Center when you have like an entire constituency pretty much that's at the top of the list, and yet there isn't one really that close. I mean, maybe Canterbury, but for a lot of those residents, that's not close and not easy to get to. So how did you make those decisions?
Yeah, so to be very transparent, the challenge we had was twofold. One, we looked at access, egress, some of the provincial requirements for distancing when we set these clinics up. As you know, you'll be received, you'll be identified, you'll get your vaccine, then you've got to go to a waiting area, we've got to have distance, then we've got to have capacity to clean. And it wasn't a perfect science, to be honest. We had all the list of needs, and we tried to spread it out throughout the community to east, west, south, etc. When we're at the mass vaccination, to your point, Councillor Deans, about a higher risk, that wasn't one of the criteria. We're hoping to get those high risk communities done through this other model, and then this is like general populations going there. Is it perfect? Absolutely not. And I would tell you, we may as we're setting some of them up, and a lot of them have already been completely set up and we're ready to go. We're realizing things, so there may be some other adjustments, but no, that wasn't really a criteria. At that point, we were thinking, now it's how do we distribute them as equitably as possible so the vast majority of the population can go there relatively easily. It meets the provincial criteria inside for the clinicians, and it has, access, egress, and some of the other security considerations. So it was a balance.
And if I may add to that, we will continue the focus on the highest risk, or the communities with the highest risk rates of COVID. So if there's ongoing need to reach those populations, that kind of more tailored approach to be right in the communities will continue.
Yeah, those 30 will be done, and we may be doing a lot of this work, and we are currently doing a lot of this work concurrently. So as we get vaccine, it's not that we have to do this group, and then before we go to the next group, we're doing this work concurrently. So the 80-year-olds are being done, but we're continuing to do the high-risk healthcare workers, some of the first responders, and it's a balance. And I think that's what will happen as we bleed into the mass vaccination as well.
I have one more update, sorry, Councillor, to answer your previous question. Hetherington is included in the Ledbury, Herongate, Ridgemont neighborhood. That's so again, your input on the language is important. We'll check in with you all about it.
Okay, I appreciate that. I mean, the whole
1 minute
location is important to me because of the numbers I'm seeing in the neighborhood cluster report. And I heard you, Mr. Damonte, in answer to a question, say that you didn't want to go back a number of times. So I get the pop-ups for the 80 plus and the second vaccination, but it didn't sound like you intended to go back and back and back. So I just would ask you to take a quick look at the cluster report and make sure that we're not missing an area, because I think a consideration probably should have been where the outbreaks are significant in determining the locations. I just wanted to also ask and follow up to Councillor Fleury's question about transportation for the greater clinics. I've had some older residents in my ward asking if the city has considered at all a transportation strategy to get especially elderly citizens to the vaccination centers.
Yeah, the team is currently looking at that. The challenge when we get into mass vaccination, obviously we can't have it, pick up at home and bring you to your vaccination center and bring you back. But we are looking at perhaps having some modified transportation routes or other tools. And we recognize that there will be individuals that have very difficult mobility issues that have even trouble getting to their family doctor, to a pharmacy. Those one-offs, so that the team's going to take that apart. So the model's not designed for that, but we recognize there's some other needs. So that's kind of the sub work that now is starting to begin to be prepared for that as well too. So that's an important point. Thank you, Councillor Deans.
Thank you. And just one final question. I know that the provincial portal has just been launched, but residents have been asking me if they're going to be able to select the location where they can get a vaccine through that portal.
To the provincial one, I believe yes. I know that when we're starting right now with the 80 plus, they'll be able to select the community center, but the plan is yes, you'll be able to select which, like that means some may be more overbooked than others, and if you want to get one quicker, you may be able to go to another one, but yes, that is part of the criteria.
Thank you.
Right, Councillor Kitts, please.
Thank you, Mayor Watson. Thanks very much for the presentations. I was eagerly awaiting this update. I think as one of my colleagues says, there's been a lot of excitement about the possibility of getting vaccinated, which is great. But I just wanted to be crystal clear for anyone listening on the process. So if I'm a person over 80, I do not live in one of the higher risk communities that you identified. Later in March, I'm going to hear on the radio or through social media or through a loved one that I'm now eligible. We'll use the online provincial booking tool or through the phone to make an appointment. And then I will visit one of the 7 community clinics or 2 hospital locations that you've identified. That's the process?
That is correct.
Excellent, thank you. A lot of the older adults who have reached out have been asking if they should be contacting their physicians to book their appointment, which is obviously not the process you just clarified. But I know that when we received the technical briefing at the end of January, pharmacies and doctor's office were included in the plan. So am I correct in assuming that that will be explored at a later date, not for the phase 1?
Yes, what's happened, that was the initial thinking of the province, and now they've kind of turned that around, and the physicians and the pharmacies will be additional support instead of the primary way of getting their vaccine. So initially that was the plan, that they would be rolled out as well. So it has flipped, you're right, Councillor Kitts. And I want to also indicate to you that the 7 sites, it's important because you and there's other councillors, for the rural communities, we will be setting up mobile sites that'll also be communicated. So some of those rural residents, and let's say Navan, Osgood, West Carleton, they will have mobile sites that'll be set up for them at different times of the week, and that'll be announced. So they'll be able to book to go to those rural sites as well too, on top of the 7 fixed sites that we've set up. They could do either one, but because we know there's some distance, especially West Carleton, for instance, Navan getting to Orleans is perhaps a little easier, but so that'll be another option for them too. I just wanted to ensure that that was mentioned on this call as well.
Okay, great. That actually leads into my next question. I was just wondering if you could clarify or elaborate, on the communications strategy for those rural mobile vaccination teams, because I assume there'll be an added challenge communicating that a mobile team is in your area versus, for a finite amount of time versus one of the clinics that are there, always in a static capacity.
Yeah, I'll let Andrea talk to you about the communication strategy. What I can tell you is what we'll try to do is some stability, and I'm making this up as I say because the team is working on that. So I'll let them work out the details. But for instance, we could say, a mobile team will be set up at this area in West Carleton Monday, Tuesday. The team will be Wednesday, Thursday in Osgood, Friday, Saturday in Navan, and we'll try to keep some stability so we can communicate that to people. That's probably a model that we would be looking at. And again, all those members of the community can go to any of the 7 sites and book there, but we'd be looking at a model like that. I don't think they'll be there 7 days a week. The volume probably won't require it, but so again, there's going to be some adaptation. So I hope that helps. But Andrea, for the comms strategy for those communities, maybe I'll turn it to you.
Yes, thank you. It is a very multifaceted communication strategy, as you can imagine, because there's so many different layers. So what we'll be doing is a couple of things. As mentioned, predictability is going to be critical. So we're looking at a regular rhythm so that people know which day things are going to be announced. So they'll know every week on this day, the next phase will be announced. We are looking at multiple strategies, e-newsletter, for example, where people can sign up, get the latest information. We'll be working with our media partners. We are looking at community groups through the outreach, so a wide array that's going to be targeted for every area and every level we're at.
Okay, that's excellent. Thank you all for your fantastic work. Thank you, Mr.
Great, thank you very much, Councillor Kitts. Next is Councillor Tierney, please.
Great, thank you very much, Mr. Chair, and thank you, Doctor, and thank you, Tony. You're doing a terrific job out there, and the lands keep shifting below you all the time, and you have to bob and weave, so it's most appreciated. I've brought this up several times when it comes to I've had to change my notes here because when it comes to the online portal. So we are 4 business days away from people being able to suddenly start booking in, and it sounds like they'll, and correct me if I'm wrong, they do that through the provincial portal for their shots that would take place on the 5th. How much confidence do you have in this provincial system, or are we going to take the extra step and use what we already know, run a parallel system? I'd hate to see something overwhelmed. We know as a city how crazy it gets even when we do recreational programming and we want people to book online. I need to have a certain level of faith that we're going to be able to accommodate that on day one.
Yeah. Maybe I can start by just clarifying because it might not have been clear because we've given you so much information and there's different. So the 80 plus group that we're going to do in these pop-up clinics, et cetera, will be able to book online. That's what we're doing next. Not on the provincial. The provincial portal will be available March 15th.
Correct. And that's where I wanted to go to, Tony, is please explain, where do we tell our constituencies to go to book? Okay. So March 1st. So we should, like the rest of the province, are all waiting till March 15th for the provincial portal. Dr. Etches and what she's presented to you and her medical opinion scientifically, the more we wait, the more risk we have of significant, death and adverse effects to that population. So we've upped that. So March 1st, the team is going to be communicating what we're going to use. We're going to use one of our city portals, either the public health one or we've got a portal that'll be able to take that. We're not talking mass numbers. I told you these groups, 200-300 people for some of these areas. So it shouldn't crash. So our objective is to get them done. So the 1st we'll let them know how to do that. The 5th, they'll be able to start registering, and we're going to start immunizing as of then for those high-risk communities. When we get to the 15th, yes, like the rest of the province, we'll be using the provincial system. The team, emergency management planning, we always look at having backups and options. I want to be clear, it is not our municipal responsibility. We don't have many tools that would take that huge number of vaccination booking systems, but we do have a couple. The public health has one for our flu shots. We have our hospital partners have one. So we have some perhaps backup tools if ever there was a problem. As a matter of fact, I saw that there's other communities elsewhere that have in other provinces that open up today, and all the systems are crashing in Alberta, et cetera. So I hope that doesn't happen in Ontario. I know that they've been working really hard on having a robust system, but you are correct. We're talking about a massive demand. The people want this vaccine, and then they'll all be turning it on March 15th. So, but again, even March 15th, it'll only be small categories of patients for the entire province that'll be eligible to register online. So fair enough, Tony. I just want to keep it moving quick here because there's other people with questions, and thank you for that. So now we've identified you guys are going to send all counselors a link, probably before Friday, that we can get the message out, or possibly tomorrow, where we can say, if you're over 80, you're in this category, your first day of booking is March 1st. Here's where you go to do it. And we have a lot of faith in our system that it will be stable. That's good. And then all that stuff that gets entered into our system, what's the process to ensure it gets re-entered? Because it will be parallel entry, and it will require a lot of people banging keyboards to re-enter the data because it's probably not portable, I assume.
So 2 things. We'll send you that March 1st so you can send it out, and then March 5th people can line on. And
forgive me, yes.
Yeah, and the team already have that capability then to upload it after people get their vaccine, to upload it into the provincial system currently. That's what we're doing.
Excellent. Okay, good. So you'll send us the information before March 1st that we can send out.
Right. Anything else, Councillor?
Yeah, I do have a couple more questions, Mr. Mayor. So what about, just real quick, cancer patients of any age and their caregivers? Where would they fall within the category? I had this question from a constituent. Is this something that would be dealt with their cancer center that they're dealing with, on how they would fall into the categories?
The definitive answer for that's going to come from the province about phase 2 and how they're handling this population they've spoken about with chronic disease. Unless they're receiving home care, then this would be part of how the home care agencies, the Champlain Lynn or Ontario Health, is identifying people that are eligible in phase 1. I want to emphasize for all of these teachers, transportation workers, grocery store workers, people with cancer, like the most important thing we can do right now, all of us, to protect people at higher risk is to stay home when we're sick, wash your hands, wear a mask of quality, and keep the 2 meters distance away from each other and limit our contact. Like, this is what's in our control right now. We have to focus on that. We have to really protect people still for a few months. And some of these groups will be moved up in some way according to a provincial process, perhaps, but age is most important and neighborhood is most important. And we're going to start work there, and it will capture some people along the way. And we'll communicate when we have more provincial direction.
Great. And of course, I've had questions about, some municipalities saying 1 dose versus 2 dose. Can we confirm we're not doing single doses? It's all double doses for the required double dose vaccines?
Yeah, nobody in Canada is using the idea of 1 dose only. What they are doing is delaying the 2nd dose. And we are, in Ontario, following the provincial government direction, for older adults, the 2nd dose is given on schedule. And for everyone else, the 2nd dose is deferred by a week to 35 days for Pfizer. And so it's a small deferral of that 2nd dose. And the question being discussed, by bodies probably like the National Advisory Committee on Immunization, is if we can push that deferral of the 2nd dose out further.
Okay, great. Thank you. And a final thing to Diane Deans' point, we do have our free bus service Wednesdays and Sundays for those things. And I'm sure you guys have kept that in mind if people identify that they have transportation issues, especially in the senior range. So thank you very much for the great work you do.
Great. Thank you, Councillor Tierney. Next is Councillor King, please.
Thank you, Your Worship, and thank you to Tony and Vera for your in-depth presentations. I know that OPH is using its cluster data to identify the highest rates of infection in neighborhoods. And last week's data showed 427 confirmed cases in the Overbrook Vanier neighborhoods, making them higher priority neighborhoods. After our seniors are vaccinated, I'm wondering, can we get an approximate sense of when other residents in these neighborhoods expect to be vaccinated, if not by date, because I know that that is dependent upon many factors, including when vaccines are delivered, but potentially by stage assigned, because I know that there's a staged system that the province has undertaken to utilize. Since many of these residents in these neighborhoods are low income and are also members of racialized populations. So I suppose the ultimate question that I'm asking is, can you outline the strategy that will be put in place to vaccinate racialized and Black populations, which are disproportionately affected by COVID-19 and who have been identified as priority populations for vaccination?
Vera, we'll try to tag team on this one. Councillor, perhaps I want to give you what just came out this morning. General Hillier mentioned today, so the provincial plan and some approximate dates, and I'd rather refer to them. I don't want to, give you information that is erroneous or not based in fact, and I don't have the direct answer. What they are saying is by April 15th, 75 years of age and older, by May 1st, 70 years of age and older, by June 1st, 65 years of age and over, and by July 1st, 60 years and over, and then we're into the general population. So that's the provincial statement as of today, which for them, like us, is constantly changing. I don't foresee us, because of vaccine supply, opening our 7 sites and full operation for some time yet, later on into March and the beginning of April. That doesn't mean we might not open a few of them or several of them and have like limited times. But directly to your question about the priority and the racialized communities that have been disproportionately impacted, I'll let perhaps Vera give a bit of her sense. And I want to just reassure you that everything we've been doing and as we've been adjusting and as this has been moving others has been based on science and evidence from Dr. Etches and her team and the scientific community. So we're adjusting our plans to that. So whatever they come up with, we're going to adjust and assure that that's done appropriately.
Thank you, Mr. Damonte. So again, I don't have the answer either. It's provincially driven. But I'm encouraged, Councillor King, that in phase 2, the language had been to also consider populations at greater risk due to socioeconomic factors. And that's the populations that we've described in the communities that are seeing higher rates that are more racialized because of the various experiences of racialized populations like racism and discrimination and less access to education and employment that go along with having lower incomes and employment that puts you at higher risk. It's nothing to do with being racialized, but it's an overlap with risk, and that is why we're taking a neighborhood-based approach, and we'll continue to do that. And so my medical advice is work with those communities to go down as far as we can in age. Go down to age 45 as soon as we can. If you looked again at that 3-dimensional graph, the risk is higher in communities right down to age 45. And so that I can't confirm is the provincial direction yet, but I saw some encouraging signs that they are building this into their thinking. And so as soon as that becomes clearer, we'll communicate again.
I appreciate that because many people in my community are asking, and one of the specific things that they are asking is whether such high priority neighborhoods will be considered for mobile vaccination. So once again, I'm wondering if you can just reiterate whether those neighborhoods would be considered for mobile vaccination.
Mobile vaccination is a strategy that can be helpful, and yes, we could look at it as we get further down into this. As Dr. Etches says, it's currently in phase 2. Those communities are identified. I want to I'm a little hesitant to say just directly yes, because the strategy is that when we have the 7 clinics set up, that'd be the prime area for the general population to go. That doesn't mean that we can't have mobile teams that assist or support in certain communities. But again, I want to, we have limited resource in the mobile capacity, and we'd like to pivot them because our rural communities have no infrastructure that will be able to set up that meet some of the provincial criteria. So the mobile teams will be used a lot for those areas as well too. So Councillor King, yeah, we're going to continue to work collaboratively with public health, and these elements are additional elements that we'll add into our thinking for sure.
Another question I quickly had was, except for the 5 priority areas, do we have a list of the remaining ones that can be shared with council by priority?
The list exists. It's obviously not a problem, so we could send that out and share it to you too. And the order is the order that we'll be approaching it, unless Dr. Etches and the team do some tweaking. But yeah, we can share the list with you, absolutely.
I appreciate that. And my last question really has to do with enhanced communication to physicians' offices. I know that in the last technical briefing that we had, we saw that doctors' offices would be used as a place of distribution of the vaccines. I think that this might speak to Councillor Kitt's point. I was just curious. I've been talking to some local general physicians, and they've said that they have not received any communication, and they have seniors coming into their offices asking them when can they be vaccinated. So I'm wondering if you could outline a little bit of information about the communication, who's responsible for the communication, whether it's Ottawa Public Health or whether it is the province, to really provide the general physicians some information to relate to their patients.
Councillor King, I'm sorry to hear that some primary care physicians are feeling they're not getting enough information, because it's a priority for us. Family physicians are key in our health system. They provide essential support and usually most of the vaccination that happens. And so throughout the pandemic, we have been communicating through our established emergency response messaging system. On a monthly basis, at least, we give updates to physicians through video and blog updates aimed at primary care providers and nurse practitioners. Dr. Trevor Arneson is our lead for that work. He has also been working with a group of primary care physicians who have different leadership roles in the community, and we're working through the Ottawa Health Team, which is, again, a group that brings together many different primary care providers to serve the community, to look at how we engage physicians and train physicians in the provincial, data systems that are needed and involve them. And that has started. That work with physicians actually doing the vaccinations has begun. So I think if the gap people are feeling right now that you're hearing about is, what do we tell people over 80? Well, we just got the direction that we could start people over 80. And as you can hear, we're giving you the latest today. So I expect, that this would be an update for primary care providers as well. They need to have the information for March 1st for those in those neighborhoods. And in fact, the Ottawa Health Team has been working with us in the neighborhoods named. So that there are primary care providers who've been a part of that process. I think there's a provincial role as well, and I've been engaged at the provincial role with primary care associations. So there's many different players. There's the Association of Primary Care Associations. There's the College of Family Physicians. There are different associations where the primary care leadership has been interested. They've been demonstrating that they want to help. And the kinds of things we've been tackling provincially are, well, how will they be paid? That's of great interest. So, there are ways now we can pay physicians when they're part of public health work. So I think overcoming these barriers and the commitment to ongoing communications is there. So we will continue to use these channels, and for sure, the next update, if it hasn't gone out already, like you're hearing today, it will be out this week in terms of what is the message for people over 80.
Well, Dr. Etches, I really do appreciate that update, and I appreciate all the hard work that Ottawa Public Health is undertaking, especially in this fast-moving environment. So thank you for providing that information to us. Thank you, Mr. Mayor.
All right, thank you, Councillor. Councillor McKenney, please.
Thank you, Mr. Mayor, and thank you also for asking the questions about the shelter population. Appreciate the information we got back as a result of that. Just a couple of very quick questions. I just want to confirm, in the phase 1 next priority, when you say all Indigenous adults, that includes Indigenous adults in our shelter system, which is about a quarter of the shelter residents. Is that correct? I see you nodding your head.
Yes, Councillor. I guess what we have really been doing is building on the recognition that Indigenous health service providers and the community is best able to inform the approach. And so it is through partnering with Wabano and a Kalsavik family health team that we are making vaccine accessible to First Nations, Inuit, and Métis populations. And we are hearing that they think this is appropriate in terms of being able to access vaccine, recognizing that some of the population is homeless and is in shelters. And so, the locations have been closer to homeless populations, and we are looking at a larger scale approach as well, where the Indigenous health service providers also have transportation options for the homeless population and supports and outreach teams, but also knowing it may be easier just to be immunized in the shelter. And so that's also, right, I think, as you heard, part of the plan.
Absolutely. Okay, thank you. And just because there's a bit of confusion around healthcare workers and the definition of healthcare workers around highest priority and very high priority. For example, I know that on the ministry's guidelines, pharmacists, for example, are indicated as being very high priority. But my understanding is that they have not been, say, for example, pharmacists have not been part of our immediate priority vaccination. Have you heard that? Have you heard that confusion? I've had a few people be in touch with me around the ministry's definition versus sort of our rollout.
Tony, do you want me to?
Maybe you can start, Vera. I mean, just go ahead.
So the highest priority, healthcare workers is clearly defined. Just recently, it was February 14th that the ministry released this guidance. And I think prior to that, there probably was more variability in understanding who's highest priority or not. The February 14th guidance I think it's been interpreted locally pretty clearly. I want to thank the hospitals actually who are leading a lot of this work within their own organizations to actually do that work of identifying who is highest. And that's it. That's where we're starting. Make sure the highest priority are covered. And then there's some of these community health providers are in the community. So I think you're right. Then you get into the next level of very high priority. I want to go back to my presentation though and explain age trumps everything in terms of risk almost, and so does living in a community with higher rates. And healthcare workers aren't at the same level of risk of hospitalization and dying. And so we're doing this concurrently. We're going to keep working through highest priority, very high priority healthcare workers. We'll go step by step. But we need to concurrently start with the older adults and neighborhoods of high priority. And so we will use as strictly as we can this healthcare guidance document from the province. And that's the way to proceed so that it's fair and people understand it is based on a definition of being, a frontline, patient-facing healthcare worker. That's where we need to start. We can't really go beyond that. I don't think it's justifiable until we reach people who are older.
Yeah, no, and I don't disagree. I just thought that there was some confusion, and when I look back at the ministry guidelines, I saw it as well. But perhaps I had looked at the most recent, so I will. But no, absolutely, I think that looking at this from an age and postal code community, high risk community perspective is certainly the way that we have to move forward. One last question on our ability to vaccinate in terms of immunizations per day. Apparently, Mayor Patrick Brown in Brampton just about an hour or so ago laid out their plans to immunize up to 40,000 per day. And I just note that we're looking at 10,976. Is that initial? Will we be able to get up to the 40,000 or?
Well, sorry, maybe I can answer. The direction that all the public health units have been given by the province is to be able to do 10,000 a day. That's the objective. And so the plan that we built was that. I just want to reiterate the 7 sites can do that. I'm not going to say without breaking a sweat. They've got to work hard to achieve that on a daily basis with the 8 to 10 model. We can go 24 hours. That doesn't include what pharmacists or physicians, when they come online, will do. So that'll be over and above, and those numbers can vary. And that doesn't include our rural mobile teams as well, too. So certainly we ramp up. I would suggest too that it's not a competition about how many we can do in a day. The quicker we can vaccinate our population safely, appropriately by the right methodology, I think is the way we need to go. But yes, Councillor. And then finally, what we haven't had added, and if we have unlimited supply and it comes in no problem, we can do, and we've already, as I said, planned for that. We can do drive-throughs. It can, like I know when we did a drive-through just for testing, we're doing 3,000 a day. We could probably ramp that up. We could do a mass 24-hour, 7-day days a week in all these places too. So that'll jump the numbers up. So I guess the only thing I want to reassure you is I'm very confident in our numbers. I know they're valid and we can produce that. And yes, we can ramp up to 24 hours if we need to, so the numbers can go up. And I'll let Vera's got her hand up.
Well, I just wanted to add, you had mentioned pharmacists, and primary care providers have been discussed as well, and they are absolutely able to quadruple the number of people if we can get them the vaccine. And so, these are other avenues that would really make a difference in expanding how many people can be immunized per day, and we're working on that with the province. For now, we have 100 family physicians that have said they will come to the clinics that we set up and help us in those clinics. And we have pharmacists that have joined the mobile immunization teams, and more pharmacists, are willing to do that. So maybe also back to your question about pharmacy, that's why some may actually already be immunized if they're helping in the immunization task. They could have already received immunization, whereas if not, they're in the next very high priority healthcare worker group. So I think that 10,000 number a day, that's just without these massive contributors that are ready and willing, as soon as we can get them vaccine.
Okay, thank you. I appreciate that. Thanks both.
Great. Thank you, Councillor McKenney. I'm sorry, I jumped over Councillor Hubley, my mistake. Councillor?
Thank you, Mr. Mayor. I appreciate the opportunity. I too want to thank Dr. Etches and Mr. Damonte for their work. I think I find myself explaining to residents when they ask us about the processes that we've asked you over the past year to make decisions based on the information you have in the moment. And one of the things we have learned from COVID is that information can change throughout the day. So I appreciate that you've been willing to make those tough decisions as quickly as possible, and that, by and large, most of them have turned out really well. I also want to point out here that all that you're talking about today is dependent on the federal government getting the vaccines to the provinces on the days that they say they're delivering it, correct? Because there's been several examples of you ramping up based on dates that were supposed to get delivery, and that doesn't come through, so you've got to slow it all back down, correct?
That's correct.
Okay, thank you. So do we have any additional assurances that these dates are going to be met, or are we just ramping up now with the expectation of the delivery?
So we're ramping up with the expectation of delivery, and again, I said it earlier, until I have it in my hands, then I know we can give it. But it does appear that there is now a sense that we'll be getting regular deliveries in the right amounts. And I think if you ask me the question in a few more weeks, if that happens and we get that regular amount, as it was said, in the right amount of time, we're going to build our confidence up. But at the end of the day, we have to ramp up to be ready. And if we get it, we're putting him in arms. And if we don't, well, we don't, and we'll ramp back down. But it would appear that we're going to start seeing a flow of more vaccine on a more regular basis, which is positive.
I want to share a personal experience with you, Mr. Damonte, that I was present at a long-term care facility as well as a retirement facility when your people came in to deliver the doses for our seniors and people most at risk. And it was so efficient to watch how they all came in. It was like single file coming in, spread out throughout the building, giving everybody their shots. And in both cases, it went very well. I'm taking from your reports that that's the case across the city, that this is going well. I'm assuming all these paramedics are doing this as overtime or additional time over and above their duties, because there was a lot of paramedics there.
Yeah, it's a combination of both, and I'd be remiss. The public health team plays a big coordination role as well too, and they're there, and we have other partners too as we're starting to spread this out. So it's a great team effort, and thank you for those kind comments.
Well, please extend our thanks to your staff. Now, I got one more area I want to ask questions on here. Before Christmas, there was a lot of discussion about going into another lockdown. There was several people, including Dr. Etches, that didn't think we needed at that time to go into the lockdown. And please understand that I know you were trying to make a decision based on the info you had at that time. We saw, once we went into lockdown, we saw quite a spike in cases. So one question I have is, how was the province able to predict that spike so that they could call the lockdown? And the second part of my question is, did the lockdown reduce the numbers that would have been in that spike? Because one of the concerns I have is the effect on small businesses and on people's mental health in general every time we go into a lockdown. So I'd like to get your thoughts on that. Was it necessary to do it? And are we looking at alternatives?
Yeah, a few questions there. Let me talk about the picture and how the lockdown related to the picture of COVID in the community. So what we saw was just before, just before the holidays, December 25th, the province was discussing the need for a lockdown because they were seeing cases rise across the province, and we weren't really seeing that rise in Ottawa. And so I was speaking to our local data, yet we know that we're all connected, and I think we're seeing a rise around us in the geography at that time. The lockdown came into effect, I believe, the 26th, and the rise did come in Ottawa after that, knowing that when it's going up like that, it reflects the actions 2 weeks prior. So we were seeing people start to socialize more and get together more mid-December. And it did lead to an increase that I believe did warrant, when we saw that rapid rise, the lockdown. Because it was so quick, it was going up so much, we needed to really send the message and break the interactions between people. And it was effective because we saw, and I don't, whether it was people's own decisions to do this or the imposed lockdown, it's a combination. But in the end, the effect was more people had fewer contacts. The rates came down. Of course, we want to avoid another lockdown. And that's why my message is today, really, as we're starting to see the very, signs that there's no longer a decline of COVID in our community, it's starting to tip the other way. Now is the time to go back to that very important part about limiting our social contacts. Because if we do that now, we won't see it go up as far. But unfortunately, we're still looking at a rise, most likely. That's why I say I think we can still get into red even next week, is because it's reflecting what's happened 2 weeks ago. And sometimes just that very message, like we're going to come out of lockdown, gives the message it's okay. We're going to start schools, it's okay. And people gather just a little bit more in a more relaxed way, a little bit less tension to distance, a little bit less masking, more connections. And that in its own, we've seen it every time there's been an announcement that things are going to go open again or back. It's a little bit like it sends that signal that our guard just doesn't stay up. So I think we want to hear the message today that our decisions today will affect what we see in 2 weeks in terms of our rates, and we want to stay out of lockdown. And so we can, but it matters what we do today.
Thank you. I appreciate that heartfelt answer, and I agree with you. When it comes to life-threatening situations, we are much better to be safe than sorry. And so I fully agree with your decisions. I look forward to finding out how we can avoid future lockdowns with all the reasons that you've said, how we're going to be able to convince the public that the two are connected, that if they follow your advice, then we won't get any more of these lockdowns that are so crippling to local business and to everybody's mental health. So thank you so much again for your answers. And that's it for me, Mr. Mayor.
Right. Excuse me. Thank you, Councillor Hubley. Councillor Eglai, please.
Thank you, Mr. Mayor. I'll keep this very brief. It's just a couple of quick questions that have come out of the presentation, Mr. DeMonte. I think these are both directed towards you. I can't recall which slide number it was, but it indicated that in phase 2 that you would be moving to vaccinate older adults. But I don't believe that the slide gave sort of the parameters or definition of what an older adult might be. So before we share this information with our constituents, I'm wondering if you give us some context as to what is meant by the term older adult in phase 2.
Thank you, Mr. Mayor. So phase 2 also on the slide, and I know the one you're referring to when we debated to do the presentation, we wanted to give you more information than less, and we put it there. That is the phase 2 projected plan. But I want to be clear, phase 2, a lot more guidance needs to come from the province. And Dr. Etches was explaining earlier, about high-risk chronic conditions and cancer patients. We need that direction. So what we know for sure is phase 1, and then phase 2, what we know is that older adults in tranches of 5 years are planned to go next. So that's what that general statement says. So, 75 and then 70 and 65, et cetera. So that's what is there. But again, I want to reiterate, until the province defines that and makes it clear, and we enter that phase, that's when we'll give you more clarity.
So, and the second question is I think a very practical one. So, some people have raised, what happens if other people show up that don't necessarily fit in the category and that sort of thing. And I'm thinking of seniors, especially over 80, who may have registered and show up to be vaccinated. What are we going to require by them? Many seniors of that age don't have a driver's license anymore, for example, to say I'm Tony DeMonte and this is where I live. So are we going to go with sort of the universal health card that everybody has to prove who you are? Or I wouldn't want to see a senior show up having registered and then being told that, you can't prove who you are or where you live. So sorry, we can't help you today.
Agreed. So the system of registration is supposed to have a pre-register. So we're supposed to have that worked out before you arrive, so you don't displace yourself to arrive and not. So as you give the example, so Keith Eglai shows up, all those pre-identification elements to ensure that you meet the current criteria at that moment to show up at a site should be done there. So when you arrive, we will have little of that. There'll be some basic information. You'll arrive, Keith Eglai, your health card, you're already registered, okay, that's fine, and you'll go through. So we hope to avoid those circumstances. And again, at all those sites, we have a public health lead, a nurse will be there. So for those one-offs, we're going to use good judgment and appropriateness, and remember that we're in a pandemic, and our objective here is to get us out of this pandemic and move forward. But if the system works as it's supposed to and as it's being developed by the province, we'll be in good shape.
If I can make a suggestion, Mr. DeMonte, when you send out the information, as I think Councillor Tierney requested, that we can share, if hopefully it's known at that point, at least with what system we're using, what an individual should have available to them as they log on, because sometimes the log on time takes a while too. So, you should have your health card in front of you. You should have whatever in front of you so that you know what to input. I think that might be helpful.
Okay, members of the team are listening. I'm sure they're taking notes for our follow-up, so we'll assure that. That makes great sense. Thank you.
Thank you.
Great, thank you. Councillor El-Shantiri, please.
Thank you. Thank you, Mr. Mayor. The benefit to be last to hear all these questions. But one question, Mr. DeMonte, for you. When you talk about food processor, is that the term you use, food processor or food preparation? One of your slides, you talk about where would they fit. I'd like to know, what do you mean by that? Who you are, who's that audience?
Yeah, food processing industry. So again, the previous question of your colleague, we need more provincial guidance that'll determine that exactly that. But in the general sense, it's people that work at Sobeys, people that work in industries that prepare foods, the Maple Leafs of the world, et cetera. That is what that general category is meant to. But it's like Councillor Eglai's older adult question. We don't know what that is yet. We need that direction from the province. but they will be in phase 2. So we're not there, and they will determine those details for us. So I can't give you more than that general sense. Like education workers, people are asking me, is that the janitor as well as the teacher as well as support staff? We don't know. It's that category that they're looking at currently, and they will be providing us that in the near future.
Because I would like to clarify, because when we talk about food, I mean, that includes obviously the hotels, the restaurants, and so on. So clarity on it, that would be great. My other question is, and I know you answered my colleague, Councillor Kitts, about the challenge in the rural area, but I think we had a good model during the flu season, and I hope we took notes from it, and I think that was a success to some degree. The question, I think, to Andrea, I know she's on the call. Early in the pandemic, almost a year ago, we sent those information cards. We delivered them to, I don't think it was citywide, but we delivered them to area where we know we need to send the information out, because as you said, there's so many layers of communication, but when you picture an area the size of West Carleton doesn't have even daily written, we have newspaper online and other social. So I want to make sure we send some of that information in a card shape. Public Health have initiate in the early stage of the pandemic. Basically with general information, because we know the information changing rapidly, but if some basic information, where to check, what website you should go to, a phone number, 1-800 to call, something. Are you planning on something like this?
Yes, so that is the plan. We had worked with Ottawa Public Health on that initial one. And we will be doing that for the broader. It is the only way to reach every house in Ottawa and to be sure that we get all residents. So yes.
Would that be citywide, or are you going to do like you picked the last time, certain area? Or
we actually did it citywide last time.
Citywide. Okay. Oh, but it was specific to Ward 5, Ward 4, Ward 3, whatever, right? Like, because it was something specific, I believe.
Would this be the masking one? There was one on public health measures with masking and the new city restrictions and such at the time.
Okay, all right, but we can talk offline on this, because that's very important to be able to deliver in the area where it's not everyone have a communication, or have even half the time we can have a meeting on the internet because we don't have a strong broadband for that. So. Yeah. Okay, thank you very much.
All right, thank you, Councillor. Our last speaker that I have on the list is Councillor Meehan, please.
Thank you very much, Mr. Mayor. I'll make it very brief. I have a ward with that it has many of the clusters of COVID in the communities. And it's just a general area. So with the 33 neighborhoods, I'm wondering if I could take this offline and have the neighborhoods identified, because I've got letters from, in different languages, and I've been trying to target these areas. But if I can be more focused, I think I can do a better job of that. And also, are the schools involved? Because a lot of the young people that live in these neighborhoods would be going to school and then be taking, information home. So I'm wondering if we have coordinated with the schools in order to disseminate that information to a very focused group. I'm not sure who can answer.
Yes, we do see schools as a key communications channel. Absolutely, that we have used previously to share information about testing or testing availability and public health measures. So we'll make sure that we look at that as well for this.
Yeah, we just recently had a rapid testing clinic, a very successful one in Barrhaven. But some of the targeted neighborhoods where we really wanted to hit, people didn't come out. So that worries me, and I'm hoping that there's something that we can be done to make them realize, whether it's a letter in a specific language that goes home. But I'm finding it quite a challenge to get that information out to the people who need it the most.
Yes, that's the community engagement, community development approach that is so important. And I know that there are people who are paying attention to this to try to tailor the approach in Barrhaven. So I'll make sure we discuss that more specifically related to the communications around vaccine. That is a big focus now in our community engagement work, is talking to people, extending the languages used.
Okay, so not just Barrhaven, but I've got clusters in Riverside, South End, and Findlay Creek. So I want to hit those areas hard with information. Okay, so I will be asking you offline for the names of those neighborhoods. Thank you very much, and I appreciate everything you're doing. Thanks.
Great. Well, my sincere thanks to my colleagues. Some very good questions asked and good answers provided by our team. Just to remind our colleagues and members of the public, this process over the course of the next couple of weeks and really next couple of months is at times going to be frustrating. It's going to be confusing. It's not going to be perfect. And we ask people to be patient. When you think of what we've gone through in the last year, we've had the COVID-19 wash up on every single shore around the world. We discovered an antidote. We manufactured that, and it's being distributed as we speak, all within 1 year. So there will be times over the course of the next couple of weeks and months that we're frustrated with another level of government, with the pharmaceutical companies, and so on. And I ask for people's patience. This is not something that we're used to doing. This has not happened in the world since the Spanish epidemic and flu in the 1900s. So please bear in mind that our staff are working tirelessly, many instances night and day, to get the information out and get the vaccines in people's arms. And we ask for the public's understanding that there will be some slip-ups from time to time where the vaccine doesn't arrive as we thought it was going to, or there's been a crash of the computer system. That happens. It happens at all three levels of government. So I ask for the public's patience as we work together to get needles in arms as quickly as possible and as safely as possible. Alors, merci beaucoup à tout notre personnel qui est responsable, Dr. Etch.
Once more, thank you very much to all of the responsible, Dr. Etch, Mr. Demonte, all of their teams.
I know are going to get calls and are getting calls on a daily basis, asking some of the questions you asked today. So I appreciate all of those questions and certainly the answers we received. Councillor Kavanaugh, you asked that we hold the residential stormwater retrofit pilot program. The floor is yours.
Okay, thank you very much, Mr. Mayor. Yes, I just wanted to check on the information that the study is based on. I had a question regarding that, and there was concern that some of the information we're basing the study on is older. And so I just wanted to get information on, are we confident that we have the best information for this project?
So, Mr. Mayor, first, I'll take a shot at answering this question. I do have staff that can answer more questions if more details required. First of all, this is one segment of a whole suite of initiatives we've had in the Pinecrest Westboro Stormwater Management System since 2019. We had a cumulative impact study in 2019, and Council has approved a whole number of initiatives. This is just one of many initiatives Council has approved to address issues that have been problematic in this area since the 1970s. Since the area wasn't built with proper stormwater infrastructure like we do today. Council approved new design criteria for infill last year, and Council has also approved a whole series of capital projects in LRT and in some of the other city-owned properties in the area as well. So we'll continue to collect additional information over time. It is being monitored as we go through, and we'll build on our knowledge, but this is only one very small component of a whole menu of things we're trying to do to mitigate issues in this area.
Thank you. I think that was part of it, was the fact that the LRT and the tree removal was, has happened since the initial study was done back in 2010 or 2011. And so there was concern about that and the more recent floodings. And are these taking in as factors for the study, for the plan?
Yeah, Mr. Mayor, those issues are continually reviewed by our Department of Public Works, Environmental Services. This particular project is not tied to those initiatives. This particular project is part of that broader suite of mitigation measures we need recommended in this area. So we will continue to monitor the impacts of the changes in this watershed area. We are looking at new regulatory mechanisms to address infill, which is, I know, one of the concerns in this area. And that is all part of additional items that will come before council in the coming years. I don't believe that updating the previous study would change the recommendation before you today. This program stands regardless. It's a best practice. It's very similar to a program that's been in place for almost 10 years in the City of Toronto, and we think it is very worthy to be approved by council today.
Thank you very much.
Okay, thank you. Anyone else wish to speak on this item? On the motion or the committee report as presented, carried. Adopté.
Carried.
Next is item 8, numéro 8, le rapport numéro 36 du comité de l'urbanisme, planning committee report number 36, application to alter the Chateau Laurier 1 Rideau Street. Anyone wish to speak to this? On the report? Whoops. Councillor Fleury, go ahead.
Monsieur le maire, comme élu local, j'aimerais être le dernier. Je vois que monsieur...
As a local elected member, I would like to be the last one to talk, if this is possible.
Alors, le 10 juillet 2019...
On July 10th, 2019, we were sitting here.
In July, I had heard excuses from some at the table that you didn't like what was presented, but had no other choice. Many councillors said their hands were tied, even if they didn't like the addition. At the time, some even said the owner was not prepared to spend time and money on the 6th design. Some worried if council revoked the approval of the hotel owners and the hotel's owners won it at the court challenge, that the city would end up with a worse version of the addition. At that time, Timmark also said a new plan would have to go through the city's usual process, including council's approval. Some also said we don't make decisions influencing private property. Well, council, we do. Actually, most times we vote at council, we do. Think of today, 4497 O'Keefe, 847 Woodruff, 1705 Carling. You get the point. The issuance or not of the heritage permit is what council must consider today. Malgré tous ces commentaires, nous voici ici aujourd'hui.
With all of these comments, we're here sitting today. We're here because of Heritage Ottawa. I would like to thank them for their contribution, their efforts to improve a process that is difficult and imperfect.
Heritage Ottawa took on the fight most of council wasn't prepared to. Today, we have a responsibility to consider the report recommendations, to weigh the public feedback, and to leverage the tools we have at council to signify our position on this addition. The vote you are taking stamps your position at this time. The Chateau Laurier is a National Historic Site. Park Canada guidelines define that it should be compatible with, subordinate to, and distinguishable from the historic place. I strongly feel the heritage building should be the focus, and the addition should remain in its shadow to remain its architectural dominance. The latest addition in front of us today is higher. We didn't pick the architect. This architect wants something new. This is Larco's problem. We have heard from local residents, from architects and heritage experts that this addition is not award-winning design. Today's decision on the issuance or not of the heritage permit. If council either imposes conditions or refuses an application under the Ontario Heritage Act, regardless of staff recommendation, the property owner can appeal the decision of council to the Conservation Review Board. The CRB holds a hearing and makes a non-binding recommendation back to council. Council would then review the recommendation and make final recommendations. I quote Councillor Ralston-King, while I agree that this proposal meets the letter of the guidelines, I remain unconvinced that it meets the spirit. I fear that approving this addition is a step back towards cementing its worst fears. Laurier himself established the Ottawa Improvement Commission, the first iteration of the National Capital Commission, with the view to beautify what was a slumpy lumber town. To make this addition to a building which is a National Historic Site which is a piece of Canadian iconography, I can't help but think that this doesn't honor Wilfrid Laurier's legacy, says Councillor King. Comme le conseiller Brockington, je suis fier de vivre.
As a Councillor Brockington, I'm very proud to be able to represent the residents of the city of Ottawa in the capital in our capital. I think that we would be an example of the best practices. This will be good for Ottawa, for every Canadian, and we want to be well represented. We want to have a capital that celebrates and recognizes its history and the history of the country. We want to be recognized for our architecture and the protection of our heritage. Best practices are core to our city.
To clearly state to the federal government to intervene on this matter of national significance. Yes, Mr. Mayor.
Councillor King, please.
Thank you, Your Worship. Colleagues, over the last several years, the Chateau Laurier's design has elicited much emotion in the community. And while the application before us now is the result of an extensive collaboration between world-renowned heritage experts, Heritage Ottawa, and the applicant, it represents both collaboration and compromise. The immense amount of time that has been undertaken by staff and volunteers on this application is much appreciated, because without them, we would have been stuck with the previous design. At Built Heritage Subcommittee earlier this month, I spoke to the evolution of this file and its changes. I've been pleased to see some of our collective original concerns addressed through the increased use of Indiana limestone and more complementary building materials, along with a design that works to minimize the visual impact of the new addition. Also, the breaking up of the massing and adherence to the shape of the original historic hotel is better than the previously proposed block style. Importantly, the maintenance of the courtyard also adds to the public realm, which is also so important for a building which many see as a central defining feature of our city. As the chair of Built Heritage Subcommittee, I cherish the role and take the protection of built heritage seriously. Of course, this means listening to experts who include heritage preservation architects and advisors. I want to emphasize that I have spent a tremendous amount of time considering all points of view. Expert members of the subcommittee gave the proposal a C grade. To me, this reiterated what I find is the most prevailing reaction in looking at the proposed addition. It is middling, average, and of ordinary design. It represents good enough. One of the expert members of the subcommittee stated, "It is not a great piece of architecture." I believe the public's expectation go beyond us meeting bare minimum design standards and guidelines for a building considered extraordinary and one of the nation capital's crown jewels. I believe the public's expectation is that we can do better than just good enough. The only way to state this emphatically is through my vote, which is what I'll be exercising today. This is why I'm also supportive of Council ultimately making a formal request that the federal government strengthen the protections for national historic sites. Thank you, Mr. Mayor.
Councillor Gower, please.
Thank you, Mr. Mayor. I'm going to turn off my video so that my internet connection is adequate here. I wanted to weigh in today because I was chair of Built Heritage earlier this term, and I remember during the months of May, June, and July of 2019, I think the Chateau Laurier took up about 70 or 80% of my time as a new councillor, and I certainly gave a lot of thought then on how to balance all of the different factors in the decision we made at council in 2019, how to balance public opinion against policies, against conservation standards and guidelines, against directions and decisions from previous councils as well. This time around, I'm supporting the staff report and recommendations with confidence because I do think it's what's being proposed by the applicant is good for our city. This is a new hotel and event center for our city in a time when we're about to start coming out of COVID-19 and looking at economic recovery. And the tourism and hospitality industry has been hit one of the hardest. So this project represents 3 years of construction activity, a major construction project for our city. Once it's built, full-time and part-time jobs, and it's a significant upgrade to the downtown in terms of the integration with Majors Hill Park. Majors Hill Park was always sort of facing the back of the hotel. The hotel never integrated with Majors Hill Park in any way. It will now. But most importantly, because this is a heritage permit that we're being asked to approve today, I think it's important to note the collaboration, as Councillor King just did, between Heritage Ottawa and other architectural experts and the applicant. There are architectural experts and heritage conservation experts who were against previous designs who are now on board with this one, and this does have the endorsement of Heritage Ottawa. I think that's significant. We always, often when we're faced with a lot of public opposition to a project, we say to developers, please listen to the stakeholders and work with the public. In this case, they have, and I think that's something that needs to be recognized. And finally, to wrap up, I want to say, let's not be afraid of change. I learned this week that back in the 1980s, the city of Ottawa opposed the construction of the new National Gallery on Sussex Drive because there was concern about its visual impact on the Notre Dame Basilica, which is a position that just sounds absolutely ridiculous right now. What makes a city interesting? To me, it's heterogeneity in building types and design and diversity, whether that's historical, architectural, the heights, the types or the uses of the buildings and the different time periods represented. That's what makes an interesting built environment. And I know this design is not everyone's cup of tea, and there's still a lot of opposition to it. But I think overall, I suspect when we look back 20 or 30 years from now, we'll wonder, what all the controversy was really about. So I hope this new hotel, new development becomes an important part of our city, just as important as the current Chateau Laurier is right now. Thank you.
Thank you, Councillor. Councillor Meehan, please.
Thank you very much, Mr. Mayor. I have not weighed in on the Chateau previously, but I did commission a poll of my constituents to find out exactly how they felt, because there is a feeling out there that people in the suburbs really don't care about what's going on downtown, which I can tell you without a doubt is not true at all. Everybody considers Ottawa their city, and what happens in the downtown core, specifically to something as iconic as the Chateau Laurier, certainly has galvanized opinion out here. So just a couple of points. When I hear the terms meets the letter of the guidelines, here in Ottawa, that certainly is really not a high bar. I am totally discouraged that so many agencies that could have protected this crown jewel in the heart of downtown Ottawa have abdicated their responsibility. And I point to the NCC and to Parks Canada, and yes, now to the City of Ottawa. Just because there has been an immense amount of time spent on this project, and that there have been 5 design tweaks to the original design that so many people were really disgusted with, I don't think is enough reason to approve a design that is not going to improve the skyline in downtown Ottawa. This design falls short of what the Chateau Laurier deserves, and certainly the citizens of Ottawa. And we have not received a satisfactory answer as to why Larco, the owners, could not or would not allow a design that would complement this iconic building. I understand Councillor Brockington asked that question at last council meeting, and there really was not a definitive answer. And I hate to think if it just comes down to money. Now, ironically, and I've done some research on this, ironically, when the previous owners, the CP Hotels, owned the Chateau Laurier before they sold it to Larco, they had commissioned an architectural firm in Montreal to design renovations and an addition to the Chateau Laurier. And I have a plan to release these later on this week. They are exactly what the people of Ottawa were demanding for their Chateau Laurier. They would complement the historic architectural blueprint that so many of us love to see on the skyline of downtown Ottawa. It's what draws us to the downtown, this incredible building. And why we could not adopt those type of plans for this building and avoid all this controversy and give people what they want is beyond me. So I can tell you, if we approve this design today and we allow this to be built, there's not going to be any reason for people to go downtown and look at the Chateau Laurier. Yes, they're going to be the front facade, but it will not be the draw. And when the UNESCO World Heritage Site says that we are not giving this building the due respect it requires, I have to agree. So, like I said, we have not set the bar very high. We deserve a lot better in the city. And I'm asking council today to do the right thing, because we deserve world-class buildings. But if we continue to approve buildings like this and additions like this, we are never going to be a place that can say we have got world-class buildings. And I will just leave it at that. And I ask you to please today do the right thing. Don't let time and 5 design changes sway you in your vote today. Thank you.
Councillor Deans.
Thank you, Mr. Mayor. Well, just picking up where Councillor Meehan left off, unfortunately, I think Ottawa is bereft of a lot of world-class buildings. Obviously, the Parliamentary Precinct and the Chateau Laurier are principal among the most important buildings that we have in this city. And I have not supported the 5 other iterations of the renovation to the Chateau Laurier because I have not thought they were good enough. And I've been listening to the discourse in the public around iteration number 6. And the best I have heard is that it's better. But better is not best. And better to me is not good enough, especially when it comes to such an iconic building for this city that is a National Historic Site. And I have to say to Ottawa City Council members that I listened in to the Built Heritage Subcommittee discussion on this issue, and I actually found it a little discouraging because what they talked about a lot was their disappointment that the NCC had not engaged and taken care of this issue, and their frustration with the federal government and not having declared historical sites like the Chateau Laurier as national heritage sites of significance and protected. But what I took from it, what the implication I really heard in what those voices were saying is that they didn't think Ottawa City Council was up to the task. That's really what I took from what they said, that we had inevitably left this in the hands of the City Council that apparently didn't entirely appreciate the worth of this site to our city. And I don't think that's right. I think we have to appreciate the value of this site. And I think we have to do better. And as I said, better than the last 5 is not best and it's not good enough. And I don't think that we should accept second best when it comes to such an important building. And for that reason, I will not be supporting this today. Thank you.
Councillor Brockington.
Thank you, Mayor. I've said a lot already, and I will keep my comments brief. As a council, we have declared a climate change emergency. We've declared a housing emergency, and yet we spend so much time discussing a luxury hotel in downtown Ottawa. And certainly the luxury hotel on the Parliamentary Precinct, a National Historic Site, is important to a lot of people. And there's so many people that have been engaged over the years, but it's depressing how much time and how many versions there have been, and we still can't get it right. This is bland, it's boring, and it's benign. And it's typical, with a few exceptions in the city, yes, Parliament Buildings, National Gallery, of how boring our architecture is and how we're willing to say, okay, let's expand the hotel. No one's debating, Councillor Gower, about expanding the hotel. The construction jobs and the hospitality jobs as a result are very welcomed in our city. And I want to see the Chateau, like every other hotel, be successful. but this is our opportunity as a council to comment on the heritage permit for a National Historic Site. And we've heard loud and clear from folks that is not good enough. And that's why I've spoken up. This is my 6th vote. This is also the 6th version, but I have already voted 5 times on this at the Heritage Subcommittee, Planning Committee, Council, and now it's come back to Council for a 6th vote. And so I've said, listen, yeah, I've appreciated all the time, effort, and energy. The owners wanted to do this back in 2017. We said, hey, don't interfere with our 2017 celebrations. And so the owner took it off, and I don't want them to think they now have to be rewarded with this design because they played game years ago. We have an opportunity to continue to push and communicate what our expectations are. So I'm disappointed in that regard. Yes, some improvements have been made, but like I said, it's not good enough. So yes, for a National Historic Site, our federal partners should be at the table with us, enforcing and expecting a better design than what we've had. So it's been quite frustrating. Not as someone who's been actively engaged as the local councillor sitting at that table, seeing time and effort that's been put into this and what we get back as far as the version. So I can't support this. I'm maintaining my vote as I voted before. And really coming out of this, we have other national heritage buildings in the city who are going to be renovated or even expanded at some point in the future. We need to have much better expectations with our federal partners about how we can work better together from this point forward. So thank you, Mayor.
Councillor Luloff, please.
If anyone on this council believes that Ottawa does not invest in a world-class architecture and world-class buildings, please reach out to me and I'll arrange a briefing for you on the joint Library and Archives Canada OPL building. This is a LEED Platinum building with incredible architecture that went through some of the largest public consultations in the city's history. And if you're not familiar with this incredible piece of architecture, just reach out to me. Thanks very much.
Thank you. Councillor Kavanagh.
Thank you, Mr. Mayor. I remain disappointed that we're going with good enough. I was listening in on the committee, and that seems to be what we're going with. My concern is that it lacks courage, as opposed to going to something that mimics the current Chateau Laurier. I actually would have been thrilled to see something that's actually does something different. I mean. And that may not have been popular with the public either, but I think that that's the way to go is to have some courage and some oomph. We do have good examples, and I appreciate Councillor Luloff pointing out that we will have more examples. That's great. This isn't one of them. And I mean, I'm thinking of the Louvre when they put on the addition there. It was not well accepted, but it was because it was nothing like what was there before. I like that stuff. I like it when it's different and it's edgy. And I think that the public would, in the end, enjoy something along that line, not just, something that is totally practical in terms of its function. Thank you.
Point of order, Mr. Mayor, because my name was mentioned. We're talking about the difference between a privately owned building and a publicly owned building. We have incredible publicly owned buildings, incredible public spaces. And if the councillor would like a briefing on the OPL-LIC joint project, the invitation is extended.
Hey, thank you. Thank you. Councillor, thank you for that. Councillor Harder.
Thank you, Mr. Mayor. I was not going to speak on this, and I don't actually speak very often, but I did want to take the time because all of a sudden we have some colleagues who have become architects or, have served on planning committees their entire careers, which is not the case. But we do have a very dedicated Heritage Ottawa group of people who have worked incredibly hard on this file. It's important, not just to the people that we heard from over these many years, over 3 years, but it certainly is personal and important to them. And it was very difficult for them to come to a decision, but they did. And I appreciate that. I appreciate all the work they put into this. I appreciate all their comments. And on a personal level, I think that it has grown us tremendously with regard to heritage in our city. None of us are experts. Most architects have a different opinion. Most people that design have different opinions. But we count on an excellent staff at the city. I think they have grown through this process. They certainly have spent a lot longer on it than they would have ever anticipated, something probably less than a year to something longer than 3 years. But they did it hand in hand with experts. They did it hand in hand with a willing owner who is going to invest multi-millions of dollars in our city. Thank you very much for that. And they did it with the help and support of Heritage Ottawa. And one person came out to speak to the joint meeting. One person. So for all of you that commented on what you heard that was said, who said it? I think some of the colleagues that are not voting for it said it. But we have, after a long time, come to a place where I think that we have something that is deserving of our support. That's why I voted for it, and that's why I'll be voting for it again today. Thank you.
All right, thank you. Does anyone else wish to speak to this item? Let me offer a couple of comments, colleagues. I know this has been a challenging file for members of the public and members of council. And I want to thank everyone, including our members of council and members on the Planning Committee and Built Heritage Subcommittee who've taken part in this dialogue. Je tiens à remercier tout le monde, y compris tous les membres.
I want to thank everybody, members of council who took part in this discussion.
Prosecute the entire debate, so I want to offer some high-level comments on where things stand today. The city's most trusted heritage partner and advisor on heritage matters, Heritage Ottawa, has approved the proposed design. Let me rephrase that for clarity. The organization that we have historically gone to for advice on heritage matters, all volunteers, by the way, have worked tirelessly behind the scenes and agreed that it would support the new design moving forward. Like us, they are keenly aware of the conflict between the proposed design and the fact that some people still don't like it. But let's face the facts today. Even architects can't agree amongst themselves as to what this addition should look like. And so I know this will never be a unanimous vote at City Council. Today, I want to state what should be an obvious and let you all know that I'm prepared to acknowledge that designing buildings really is not our role nor our expertise. Now, some people will never accept that the addition will not be a replica of the Shadow, but let's be crystal clear on that. Many experts in this space have indicated that an addition must be of its time and distinct and not a replica. And let's face it, every time the architect comes back with an improved design, the opponents move the goalposts. Chaque fois que l'architecte revient avec un concept
Every time we will propose an improved concept, the opponents will change their refrain.
Council unanimously carried a motion by the then chair of the Built Heritage Subcommittee, Councillor for Rideau Rockcliffe, Toby Nussbaum, calling on the developer to namely, quote, meaningfully increase the use of Indiana limestone cladding on the building exterior, end quote. Staff has clearly indicated, under the able guidance of Steve Willis, our General Manager of Planning, Infrastructure and Economic Development, that our proponent has met or exceeded all of the conditions unanimously carried by Council in 2018. Mr. Willis, can you confirm that that is still staff's position? Mr. Willis.
Mr. Mayor, Heritage staff agree.
Thank you. Yet a handful of members of council will still want to treat this as a political hot potato. We had one member of council who fully endorsed the very first iteration and was actually quoted in the corporate press release praising LARCO. And then that changed. Then there were some suggestions, ridiculous I would call them, that wanted the federal government to buy the building. Can you imagine, in the midst of a pandemic and an economic downturn, the federal government spending hundreds of millions of dollars to buy a luxury 5-star hotel? How would that go over in Alberta or Halifax or Winnipeg? If you actually ask them and challenge them on the design, they have no specific proposals to alter the design, then we should simply reject it. Today, we're at a crossroads, and we have the opportunity to get this proposal across the finish line and turn our attention to other pressing issues. We all hope that in the coming months, we can start to emerge from the pandemic as a stronger city, province, and country. Unlike ourselves and public servants who have the privilege of accepting a paycheck deposited in our bank account every 2 weeks, there are literally tens of thousands of workers in Ottawa who don't know when they'll get back to work and start earning a decent wage to support their families. And as we all know, the tourism and hospitality industries, which are vital to the lifeblood of the Ottawa economy, have been some of the hardest hit over the last year. So I ask members of council to turn their minds to the thousands of unemployed or underemployed workers in our community. When I was able to be out and about in our community before the pandemic, I had the privilege of meeting literally hundreds of residents from all walks of life in shops and malls, community centers. And like a young family in Overbrook I met that had just bought a house and they hoped to improve their retirement nest egg. This two-income household was then supported by a job in the construction industry and a job in the tourism sector. With a single mother on Hannah Street in Vanier, managing to stay afloat thanks to 2 part-time jobs in the hotel business while studying part-time at La Cité Collégiale. Il y a des centaines d'exemples d'un but ou l'autre.
There are hundreds of examples throughout the city.
All members of council that outside of City Hall, the vast majority of our residents are not talking about the Chateau Laurier. And as Councillor Harder indicated, there was a grand total of 1 public delegation that came to the planning committee meeting that opposed the design. They're talking about their desire to get back to some level of normalcy in their lives, with the most important being economic normalcy. And that's why I urge all members of council to support the Heritage Ottawa Compromise today, so we can get back to the business of running our city and supporting all residents who have lost their jobs. These residents expect us to pull out all the stops to get the economy going. This has been exacerbated by the Chateau Laurier, or for the Chateau Laurier's, council approved the demolition of their dilapidated and unsightly concrete parking garage and the garbage room. Just remember what we're replacing. We're replacing a garbage room where they stored the garbage and a concrete parking garage, and they tore those down in January 2018. Delaying this will make it difficult for this organization to compete after the pandemic without this addition and without the ability to reinstate parking for its guests. The opponents who want us to start over again are losing sight of the fact that another delay, likely past 2022, means that the Chateau redevelopment will have been on hold for over 5 years. Yet hundreds of decent jobs rely on full reopening of this vibrant and historic destination. This $100 million addition will also create 500 good construction jobs during the 3-year build. And finally, I want to reflect on the fact that we will start the 2022 budget process in a few months. During that time, I will meet with all members of council, and many of whom have ambitious proposals on how to spend more money than we currently take in. And the proposed addition that we're voting on today is expected to contribute $5 million in new municipal taxation every 10 years, and that's a prudent estimate. These are actual new tax dollars that our city will have to spend on our numerous and growing priorities, like housing and caring for our most vulnerable residents, or making investments to protect the environment or improve the transportation and offer better parks and roads and pathways. Members of council, I urge you not to look down on the city of Ottawa and speak so despairingly and negative about we don't have world-class buildings. We do. Our job is not to simply be cheerleaders, but to be realists. And the reality is that we have a city that is chock-a-block full of beautiful architecture. The War Museum, the retrofit of the National Arts Center, the National Art Gallery, the beautiful addition of the lantern at the Museum of Nature. And as Councillor Luloff pointed out, the beautiful new library that will be kickstarting the LeBreton redevelopment and renovation project. So I urge you, let's turn the page on this issue today so we can now turn our minds to more pressing matters, including our urgent task of regaining the jobs that we lost during the pandemic. I urge you to support staff and Heritage Ottawa and their very strong recommendation to uphold the agreement that was reached between Heritage Ottawa and the proponent. Yeas and nays, please.
Councillor Suds.
Yes.
Councillor DeRuse.
Yes.
Councillor Gower.
Yes.
Councillor McKenney.
No.
Councillor Harder.
Yes.
Councillor El Shantiri.
Yes.
Councillor Mian.
No.
Conseil Cloutier.
Oui.
Councillor Kitts.
Yes.
Councillor King.
No.
Councillor Dudas.
Yes.
Councillor Brockington.
No.
Councillor Menard.
No.
Councillor Tierney.
Yes.
Conseil Fleury.
No.
Councillor Shirelli.
No.
Councillor Kavanaugh.
No.
Councillor Hubley.
Yes.
Councillor Eglai.
Yes.
Councillor Luloff.
Yes.
Councillor Leeper.
No.
Councillor Deans.
No.
Councillor Moffat.
Yes.
Mayor Watson.
Yes.
14 yeas, 10 nays.
Thank you. Next item is disposition of items approved by committee under delegated authority. Received. Motion to adopt reports. Motion portant adoption de rapport. Councillor Mian, please. Councillor Mian.
That the report from the Ottawa Police Services Board entitled Board Activity, Training and Performance 2020 Annual Report, Agricultural and Rural Affairs Committee Report 19, Community and Protective Services Committee Report 16, Standing Committee on Environmental Protection, Water and Waste Management Report 14, Planning Committee Reports 36 and 37, Transit Commission Report 9, and the report from the City Clerk entitled Summary of Oral and Written Public Submissions for Items Subject to the Planning Act Explanation Requirement at the City Council meeting of February 10th, 2021, be received and adopted as amended.
On the motion, carried. Adopté. Motions of which notice have been previously given. Motion dont avis a été donné entièrement. Councillor Kavanaugh, I believe. I'm sorry, it's Councillor Deans, and seconded by Councillor Kavanaugh. Councillor Deans, please.
Thank you, Mr. Mayor. I am incredibly honored to move this motion once again this year to mark March 8th as International Women's Day in the City of Ottawa. I'd like to take this opportunity to thank Councillor Kavanaugh and Councillor Meehan for moving and seconding this motion last year when I was on a medical leave of absence. I also sincerely thank all of my council colleagues for your previous support for this declaration and to celebrate this day. I am tremendously proud and grateful that over the last few years, our city has focused on gender equity issues and has acted by implementing a special liaison on women and gender equity, which our colleague Councillor Kavanaugh admirably undertakes each and every day. As well, the City of Ottawa embarked on its first women and gender equity strategy and now employs a specialist on women and gender equity, Ms. Sassan Al-Rafai, who ensures we apply a women and gender lens on several of the city's strategies and plans, such as the new official plan, the community safety and well-being plan, and the corporate diversity and inclusion plan. I am also extremely pleased that later this year, a report will be submitted to council to approve phase 1 of the Women and Gender Equity Strategy, which is a long-term commitment to the City of Ottawa to work toward gender equity. I'd like to thank the Women and Gender Equity Strategy Working Group, which is comprised of more than 15 community organizations, for their work in guiding the development of this strategy, along with Council Sponsors Group, which is chaired by Councillor Kavanaugh and includes Mayor Watson, Councillor Suds, Councillor McKenney, City Manager Steve Kanolakos, General Manager Donna Gray, and General Manager Valerie Turner. International Women's Day will be a day to reflect on the impressive gains women have made, but also to acknowledge that more work is needed to advance gender equity issues. One way we can all do this is by choosing to challenge gender biases and forms of gender inequity that we see in our lives. Choosing to challenge is the International Women's Day 2021 campaign theme. As you know, for many years, I have hosted an annual International Women's Day breakfast celebration to recognize the achievements and future opportunities of women in our community. Due to the COVID-19 pandemic, my annual event will take place virtually this year. I would like to take this opportunity to invite all of you to attend this event, which will take place on Monday, March 8th from noon to 12:30 p.m. I encourage Council to once again recognize this day and celebrate those who continue to strive for equality and excellence for women. Together, we are making a difference. Thank you.
Great. Does anyone else wish to speak to this item? Just offer thank you, Councillor Deans, for upholding your annual tradition. It's gone on for, I think, 25 years. Congratulations. Also remind members and members of the public that on International Women's Day, Monday, March 8th, we as a city will once again host an event to inspire and celebrate women in our community and hear from an engaging guest speaker. And this year, of course, like Councillor Dean's event, will be taking place virtually. It's hosted by myself and Councillor Kavanagh, the Council Liaison for Women and Gender Equity. And we'll provide an update on the Women and Gender Equity strategy at that time. And moderating this year's event will be our newest member of Council, Councillor Catherine Kitts. And we'll feature a discussion with our guest of honor, Dr. Vera Etches, Medical Officer of Health. And we'll hear a spoken word poem from local poet Fatima Zahra. The virtual broadcast will take place on Monday, March 8th, 2021. From 8 a.m. to 9 a.m. and it will air in the following places: Rogers Cable 22, Mayor's Facebook page, City of Ottawa Facebook page, and City of Ottawa YouTube channel. And the theme this year is Choose to Challenge. Since this event is online this year, we encourage everyone to tune in. As you know, we've always had to, unfortunately, limit the number of people that can come in years gone by because of fire regulations at Jean Piggott Hall. And we've had to turn away many people every year. So this is an opportunity for everyone in the city to participate on Monday, March 8th. Again, sur le câble 22 de Rogers, Facebook.
On channel 22 of Rogers Channel 22 on the Facebook page of the City of Ottawa, as well as a YouTube channel.
Oops, we have someone who's come in after my comments, Councillor Kavanagh.
Sorry, Mr. Mayor, I did just got my hand up just before, but that's okay. I just want to give my thanks to Councillor Deans and also Councillor McKenney, who did a lot of work in working towards this goal of having gender equity as an issue here at City Hall. So I give my warmest thanks to them for all the work they did to prepare us. And as you've read out, we've had a number of accomplishments, and we're having more. And I appreciate all the hard work and of staff, and also on the fact that we've brought in equity in a more holistic way, and we are looking at equity in terms of. I appreciate all the work my colleague Councillor King is doing on that. But for now, I hope we'll all enjoy March 8th, International Women's Day, and also another welcome to Councillor Kitts on being our latest member of our council, and we appreciate her participation as well. Thank you.
Well, we'll have to get you more bandwidth. It says your network bandwidth is low, so it was a little choppy. So it could be Alex sending me letters. Next is Councillor Kavanagh again. Oh, I'm sorry, we've got to carry Councillor Dean's motion. Carried? Adopté?
Carried.
Carried.
It's a little choppy, Councillor Kavanagh, so I don't know if you want to take the video off and see if that improves it, because we want people to hear you. And you have a referral motion that you're going to introduce now.
Yes, Yes, I do. Thank you very much. This is based on a motion that I had given previous notice to, in consultation with the chair of our Environment Committee, Councillor Moffat, and the seconder, Councillor McKenney, decided that it would be best to have delegations because there was a lot of interest in the subject. It's a very large and complicated subject in terms of what we're talking about, but the ultimate concern is the quality of our drinking water and its future, and because this involves our Ottawa River watershed. So I feel that it is prudent to have delegations at committee so that we can have a thorough discussion on this matter. This is something that is very, very important to me, and I believe it's very, very important to the residents of Ottawa to have confidence in the future of our water system. Thank you.
Great. So this is a motion to refer this notice of motion to the Environment Committee. Carried?
Carried.
Then Councillor Brockington has another issue that is in tandem with that, seconded by Councillor Luloff. Councillor Brockington, if you'd like to introduce your motion, which deals with the previous one.
Thank you, Mayor. And it may seem obvious that the proponents that I'm going to discuss in a second are going to come, but I want to understand my thinking and why we should formally ask them. So first of all, just to reiterate the motion is that the city clerk or his designate be directed to invite officials from the Canadian Nuclear Laboratories and the Canadian Nuclear Safety Commission to appear as delegations at the Environment Committee to speak to the proposal and answer questions from members of council. My rationale is this. I do believe we have a formal obligation to invite these two entities to come. We need to understand what the proposal is, not just people who show up to object, but let's get into what is really being proposed so we fully understand what they do at Chalk River. How does the country benefit from their work? What risks exist in what they do today? How are those risks mitigated? And the risks located in proximity to the Ottawa River, which a lot of people are concerned about should something happen, and the Ottawa River is our water supply, get into those types of questions. So I think this is us, the City Council, showing due diligence. We formally invite these two parties to come to the committee meeting to appear as delegations to provide a presentation. And I just think back, Mayor and colleagues, post-Walkerton, the added obligation that exists on elected members of council to show their due diligence, that they're taking every steps possible. And that's why I believe a formal invite in this manner is a good thing to do. So thank you, Mayor.
Okay, thank you. Councillor Moffat, please.
Yeah, I just want to touch really quickly on the two parties mentioned in the motion. They are coming. I just want to make sure that we're not putting out the idea that these are two groups that are coming against their will, and that the only way to drag them over to committee is by moving a motion to formally invite them. They have expressed their intent to come and speak to this matter. They want to come and speak to this matter. So I just wanted to put that out there before we vote on the motion. Thanks.
Great, thank you. Anyone else on the motion? Carried? Adopté?
Carried.
Carried.
Motions requiring suspension of the rules of procedure. Motion exigeant la suspension des règles de procédure. A motion by Councillor Harder, seconded by myself. There's a timing issue with respect to EA funding on Barnsdale on suspension. Carried?
Carried.
Carried.
Councillor Harder?
Thank you, Mr. Mayor. Our transportation master plan identifies a new interchange at Barnsdale Road and Highway 416. It will add a second interchange, only a second interchange. So you'd imagine a community of 100,000 people has just one access to the 400 series highway. It's right beside, and it's in the extreme northwest corner. And the Ministry of Transport has agreed to begin the EA process, which, as you know, is a vital part of making this important project for us a reality. And it's not just important for Barrhaven, although it certainly does add to the livability for over 40,000 of Barrhaven's residents, so almost half the population. But certainly for the economic growth of South Barrhaven and Ottawa generally. It's a fantastic opportunity, and it comes to us through a relationship with the South Barrhaven Development Corporation. They're prepared to fund up to $2 million to advance this important work in support of the residential and the commercial growth in Barrhaven. Now, the city's going to play a role in it because we're going to be the bank. So we'll take in the money and we'll be working with conveying that through to the MTO. MTO will run the program, but of course, we will be there for help as needed. So I ask that you support this great opportunity for Ottawa starting in April, an EA on one of our 400 series highways.
Great, thank you, Councillor. Councillor Leeper.
Thanks, Mayor. I'm just curious why this is coming to council as a walk-on. Transportation Committee meets on the 3rd. Planning Committee meets every 2 weeks. The preamble to the motion speaks to in the coming weeks, but in general, obviously, I think it's optimal to have motions come to committee so that people can hear from delegations, etc. Why are we dealing with this today?
Councillor Harder.
Oh, well, as you know, it's going to start in, the EA study is going to start in April. I can say that the efforts between our transportation staff and the MTO have been, we've been hard at work. I think that there's probably been 6 meetings, including ones with Chair Tierney and Chair Hubley and myself. I know Councillor Moffat's been involved with it as well. And the fact that it's starting in April and they have to finalize the procurement of the group that will actually do the work between now and then. That's why it's coming here now. And it is, as I said, it is a transportation master plan item that has been on the books for a number of years.
Fair enough, Councillor Harder, but I'm trying to understand why leaving this to Transportation Committee and then moving to the immediate subsequent council meeting doesn't provide enough time. I'm assuming that this will go through, and it looks like a slam dunk. And I appreciate that a number of councillors have had a sneak peek at it, if you will, or the opportunity to work and talk about this ahead of everybody else. But as a walk-on motion, it seems inappropriate unless there truly is a time crunch.
Well, if you were here at the city, as you know, Councillor Leeper, for us to go through a procurement process to hire a company to do any kind of work, and certainly in this case, an EA for, a 400 series highway, that is no small feat. So therefore, there has to be the assurance in place that allows that to happen. And I would say that back when Chair Eglai was the chair of transportation, AMO was in town, and it was our virtual one. So I think it was 2017 August. The only ask that we had at our meeting with the minister at the time, who was Bob Shirelli, was for the Barnsdale interchange in 2017. So I would say that previous councils have been aware of this. It has been one of the priorities on the transportation master plan, and we have an opportunity to go forward, and I'm not going to miss the boat on that, and neither are any of the 100,000 people that I happen to represent with Councillor Meehan. Thank you.
Great, thank you.
All right,
on
Mayor,
the motion.
Sorry, Mayor, I'm not sure I've ceded the
Sorry, do you have another question, Councillor?
No, just as a wrap-up comment to that, I wish that I cannot understand why this would not have been brought to us as a notice of motion at least a couple of weeks ago. But I'll leave it there. Thanks, Chair.
Okay,
because
thank you.
we just found out.
On the motion, carried?
Carried.
Next motion requiring suspension is Councillor McKenney and Leeper. Here's a notice of motion on suspension, Councillor Leeper. Demolition control 818 Gladstone. Councillor McKenney, please.
Thank you, Chair. This is the address of OCH's, what will be their new development for Rochesterville, across the street from Rochester Phase 1. It's just the remainder of the townhomes that are standing on Gladstone. This is just to allow demolition without an application. There's no building permit obviously yet for replacement, but with the secondary plan that we'll be approving tomorrow, that will all be put in place for us to start moving ahead with a pretty aggressive plan to build affordable housing in the new Corso Italia district secondary plan.
Great. On suspension, carried.
Carried.
On the motion by Councillor McKenney and Leeper, carried.
Carried.
Adopté, merci. Next is a motion by Councillor Fleury, seconded by Councillor McKenney, also on demolition control 374 MacArthur Avenue. On suspension, carried. Councillor Fleury.
Thank you, Mr. Mayor. Same format of motion. This is right across from Robert E. Wilson on MacArthur. I don't know if the clerk can put it up so that there's specific clauses that, here we are. And we have an applicant that's pursuing an application, but the community and pre-consult has asked for goodwill and fast tracking the demolition. So here we are with the owner's will to proceed with a demo as early as possible in the spring. So do you want me to read the therefore be resolved, Mr. Mayor?
No, I think people can see it on the screen. On the motion, carried. Adopté, merci. Next motion requiring suspension of the rules of procedure is moved by Councillor Harder, seconded by myself. With respect to appointments, Council Sponsors Group for New Zoning Bylaw Project on suspension, carried.
Carried.
Councillor Harder.
Thank you, Mr. Mayor. This motion that you would have received a copy of is to create the Council Sponsors Group with regard to the very important new zoning bylaw project that will put into effect the official plan when we approve that later this year. There's about 5 years of work to be done. So I wanted to say that I have asked Vice Chair Gower to represent myself as the chair of the planning committee. So in his role as vice chair of planning, and then the other people who willingly offered their time, and I'm wondering if they actually know how much work is actually involved in this. It's going to be a heavy workload, but thank you very much for doing so. And these folks are Councillor Gower, Councillor Dudas, Councillor El-Shantiri, Councillor Menard, Councillor Cloutier, and Councillor Hubley. So I ask that you support them as the members of the sponsor group.
Okay, so on the motion is presented by Councillor Harder, seconded by myself. Carried. Adopté. Are there any other motions requiring suspension of the rules of procedure? I think Councillor Fleury, if I'm not mistaken, you've agreed to deal with the strengthening of the protection of National Historic Sites now so we can suspend?
Yes, thank you, Mr. Mayor. I did have
on suspension. Carried. Councillor Fleury, the floor is yours, and it's seconded by Councillor McKenney. We can get that up on the screen, please. Just a moment, please.
So thank you, Mr. Mayor. This stems from comments that we've received throughout the application of the Chateau Laurier, and it really addresses the National Historic Sites. So I'll read it. Whereas the report for the application to alter the Chateau Laurier 1 Rideau Street, a property designated under Part 4 of the Ontario Heritage Act, and as a National Historic Site of Canada, details a rear addition of 2 stories of 10 east and 11 west stories connected at grade by 2-story base
to the Chateau Laurier, and whereas the City of Ottawa supports the intent of the federal government's National Historic Site program, and whereas the federal government's National Historic Site of Canada designations are purely commemorative, bringing no legal protection, and whereas there are approximately 740 National Historic Sites held by non-federal owners in addition to the 228 owned by the federal government, and whereas the standards and guidelines for the conservation of historic places in Canada were created jointly by the federal, provincial, and territorial governments to guide decisions around historic places across the country, including federally owned National Historic Sites, and whereas the application to alter the Chateau Laurier has highlighted issues with the protection of National Historic Sites, including federal oversight for the properties designated for their national historic significance. Whereas the House of Commons Standing Committee on Environment and Sustainability issued a report entitled Preserving Canada's Heritage, the Foundation for Tomorrow, in December 2017, which acknowledges that Canada is the only G7 country without comprehensive legislation on its built heritage. And whereas the National Historic Sites are at risk in the current context where the federal government provides no financial or technical supports to projects at National Historic Sites owned by private and non-for-profit entities, and negligible financial support for non-profit owners. And whereas throughout the process of altering the Chateau Laurier, there's been significant volume of resident engagement, voicing their strong desire to conserve the Chateau Laurier for its role as National Historic Site, and therefore be it resolved that Council approved that the Mayor send a letter to the Federal Minister of Environment and Climate Change responsible for Parks Canada to formally request the federal government to strengthen the protection of National Historic Sites by 1, providing federal oversight to National Historic Sites and clearly defining roles for the approval authorities, 2, providing leadership and technical support to municipal and provincial territorial officials who are responsible for project approvals, such as Heritage Advisory Panel at National Historic Sites. 3, providing leadership to advance. Mr. Mayor, I'm getting a feedback. Yeah,
just looking into that.
No, I'll get 3, providing leadership to advance understanding of heritage conservation throughout the design and construction sector, and 4, providing technical support for owners contemplating alterations to National Historic Sites.
Okay, thank you. On the motion, Mr. Willis, are you comfortable with this motion from a staff perspective?
Yes, Mr. Mayor, we are.
Okay, so on the motion, carried. Okay. Right. Next, any other motions requiring suspension of the rules? I see none. Notices of motion for consideration of subsequent meeting. Councillor Suds, seconded by myself, with respect to Integrity Commissioner recruitment. Councillor Suds, please.
Sure. Thank you, Mr. Mayor. As I believe my colleagues received notice yesterday, the contract for the city's current Integrity Commissioner, Robert Marlowe, is set to expire on August 31st of this year. So persuasion to the council approved statutory officer recruitment, appointment and contract administration policy and procedures. We do have a notice of motion here that would, once tabled, begin the recruitment and appointment process for a new Integrity Commissioner.
Yeah, so that will be debated at our next council meeting. So thank you, Councillor Suds, for that. Any other notices of motion for consideration of subsequent meetings? Est-ce qu'il y a des autres avis de motion? None. Motion to introduce bylaws. Motion portant présentation de règlement. Councillor Meehan, please.
Thank you, Mr. Mayor. That the bylaws listed on the agenda under motion to introduce bylaws, 3 readings, be read and passed, with the exception of the bylaw listed as Bylaw C, a bylaw of the City of Ottawa to amend bylaw number 2008-250 to change the zoning of the lands known municipally as 1705 Carling Avenue, as the associated item has been deferred.
Carried. Adopté. Confirmation bylaw, Councillor Meehan, seconded by Councillor King.
Coming up. 2 seconds. Okay, coming. It is, okay. That the following bylaw be read and passed to confirm the proceedings of the council meeting of the 24th of February, 2021.
Carried. Adopté. Under inquiries, colleagues, I've once again appointed my liaison on flood prevention issues to Councillor El Shantiri, who is dealing with the province and various conservation authorities, and he's going to give us an update now on the spring freshet, which is coming shortly.
Thank you, Mr. Mayor, and I believe you'll be receiving shortly a memo to Council about 2021 freshet from Mr. Lathbridge, Jim Lathbridge. This is the freshet commander for 2021. Obviously, we are preparing for this year under the COVID protocol or COVID restriction, as we did the last year. I was appointed also by AMO to work with the Ministry of Natural Resources and Forestry to with their working group and working with the Ottawa River Control Board and Hydro-Quebec, Hydro-Ontario Power Generation. And we had 2 meetings on behalf of AMO and Roma, and obviously is a concern right across the province, but in our area is the Ottawa River from Témiscamingue down to the Crillon on the Quebec side. So that's we'll keep an eye on, and there's work's been done, but there's a lot more work to be done. The ministry has agreed to start peeling some of those recommendations by Mr. McNeely was hired last year. Anyway, I don't want to take too much of your time because I know it's been a long meeting. Just want you to know on the Rideau River flood control operation as past year, the city in partnership with the Rideau Valley Conservation Authority will undertake ice breaking and clearing along the Rideau River in February and March. I think some of us seen that work undertake. And this work will allow the water flow unrestricted to alleviate the possible spring flood in flood-prone areas. So we will continue working with our city staff. They've been doing a great job working with other colleagues across the province, especially the Ottawa River Control Board, which they invest quite a bit in water measurement from here all the way to Témiscamingue. Obviously, we need more work done for the flood mapping, but that's right now. The city did flood mapping through Mississippi Conservation Authority, but other municipality, unfortunately, they can't afford the undertake. So we're working with the province to find a way to fund it, because it's no point one municipality have the flood mapping and other don't. So it's work in progress, but I promise to keep you up to date, every council, a little bit of what's happening, and I will be meeting with our staff regularly. As I said, we are following the COVID protocol just like we did last year. So it'll be similar to what we did last year, prepare for ourselves as a city staff, and hopefully we won't happen a flood or a freshet. So with that, thank you, Mr. Mayor, for assigning me to this job, but hopefully we just don't have a flood.
Great, thank you. Councillor Leeper has a question to you, Councillor El Shantiri.
When do we usually get a good idea of what the freshet's going to look like? I assume it's premature right now. There's probably still a bunch of snow to come, but when do we have that understanding of likely scenarios?
I would say for the Ottawa River is. Oh, sorry, Mr. Mayor, if I may.
Oh, go ahead. I
would say within the mid-April, we start to see the sign, and we'll see the level of the height of the water. And the best way, Councillor, for you or your resident is the Ottawa River Control Board has modified their website, and it's really is helpful, and it has some information and more information coming online because more municipalities have the water measurements, so they can measure the height of the water, and keep an eye on it. So basically, in 2019, we know almost 10 days before the flood hit Ottawa, we were going to be flooded. So because the amount of water was coming down on us from Timiskaming and in that area. So the best way is the Ottawa River Control Board, but at the same time, our staff are working with the Ottawa River Control Board to bring the information. And I just heard from Jim Lathbridge, every council he will be providing update to us.
That's helpful. Thank you very much, Councillor. Thanks, Mayor.
I have to share a note I got from Councillor Luloff. He's got a new name for you, Eli. You're the Freshette Prince of Constance Bay. Councillor Kavanagh.
Thank you. I just wanted to say I appreciate that staff are being proactive. It's the end of February. We're getting ready for Freshette season. It's always important. And I look forward to working with my colleague, Councillor El-Shantiri, as well as staff, as well as the Rideau Valley Conservation Authority and the Mississippi Conservation Authority on protecting people during that season, during Freshette season. Thank you.
Thank you. Inquiries. I have an inquiry to the Treasurer. As part of the Government of Ontario's 2020 budget, which was tabled on November 5th, 2020 and adopted on December 8th, 2020, the province announced a new tool for municipalities to create and design an optional small business tax subclass as part of its commercial taxation structure. Many members of council have worked closely with small business owners throughout the COVID-19 pandemic and have sought ways to offer support and relief. In light of the ongoing hardship that small businesses are facing due to the pandemic and its associated lockdowns, I'd ask that your staff assess, 1, how the city would define the small business tax subclass, 2, what level of reductions in property taxes could eligible small businesses benefit from under this tax subclass, and 3, how could these property tax reductions for small businesses be funded without shifting the burden to the residential class. I'd ask that you conduct this analysis and to report back at the April meeting of FEDCO in the context of your annual tax policy report. Any other written inquiries, Madam Deputy Clerk?
Mr. Mayor.
Councillor El-Shantiri.
I know this is inquiry you have submitted today, but it'll be possible for our staff to give us a little bit more information. So if they are looking at this, is that going to have any impact of what the federal government already have in place? Like, we don't want to work against each other. I'm just wondering if staff can add that to your inquiry and give us more info about it.
About the provincial subclass? I'm not quite sure I understand, Councillor.
The federal, Mr. Mayor. As you remember, the federal have in program with the landlord to provide some compensation, but the landlord, in a way, they lose 25% if they enter that. So I just want staff to look at the whole holistic, not just what's in there.
Yeah, I think, Ms. Stephenson, if you could take that into account with the inquiry, Councillor El-Shantiri's comments about any overlay of federal programs that would help, because we want the money to go right to the small business owner, not necessarily to the landlord. Okay,
yes, we can take that, Mr. Mayor. Thank you.
Great, thank you.
Your worship, thank you.
Just one quick, or actually two quick items here, colleagues. One is after the media conference, which will start at 2:20, on Cable 22, the media conference, I believe, is carried on Cable 22. There's a tribute to Rabbi Bulka and Kindness Week, and a series of vignettes of people who have talked about things that they're doing for Kindness Week and thinking and praying for Rabbi Bulka. So that will be done. That will be aired directly after the media conference, which takes place in 10 minutes from now at 2:20. And I'll just leave us on a little note here. I just got a note from a couple regarding the Wabano Center, and I'll read the comment this individual sent to me via email just a few moments ago. What I thought would be a very stressful experience was made anything but that by the wonderful and kind team at Wabano. They were gentle, helpful, and very efficient. Also, just being in the lovely spiritual building made me so proud of my Aboriginal heritage. So our thanks to our Aboriginal partners at Wabano. That's really nice feedback to hear from a member of our community. Councillor Meehan, adjournment, please.
My pleasure. That the proceedings of the City Council meeting of February 24th, 2021 be adjourned.
Carried. Adopté.
Carried.
Meeting adjourned, and the media available, as I said, will start at 2:20. Merci. Thank you. Meeting adjourned.